Committee will come to order. Good morning and welcome to the second day of our witness hearings specifically for the American Indian and Alaska Native programs. I also want to welcome all of the distinguished tribal elders and leaders here today and to thank our witnesses for appearing before the committee and sharing your concerns on these important topics. In terms of hearing logistics, I will call each panel of witnesses to the table, one panel at a time. Each witness will have 5 minutes to present testimony. Your full written statement and testimony will be included in the record, so please don't feel pressured to cover everything in 5 minutes. I know 5 minutes isn't very long. We will be using a timer to track the progress of each witness. When the lights turn orange, the witness will have 1 minute remaining to conclude his or her remarks. When the light turns red, we will have to ask the witnesses to stop. And I don't want to this is no disrespect for what you have to say or anything, but we have like 65 witnesses in the last 2 days and stuff, and we need to respect their time also so that we can get through all of these. And so I appreciate that. We'll hear from every witness on each panel. Before members will be provided an opportunity to ask questions because we have a full day ahead. I request that we try to keep things moving in order to stay on schedule and respect each other's time. I also want to note that committee rules prohibit the use of outside cameras and audio equipment during these hearings. The hearing will be viewed in its entirety, can be viewed in its entirety on the committee's website, and an official hearing transcript will be available at gpo.gov. I'm happy to yield to Ranking Member for any remarks that she may wish to make.
Forgot I was the ranking member there for a minute. Just drinking my coffee.
I know what you're talking about.
Yeah, relaxing back there. Well, I concur with everything the chair said. Our first day of witnesses was a really wonderful experience for all of us with a great diversity of tribes and challenges that everyone is facing. So I'm wholeheartedly looking forward to today, and thank you so much. I know it's never as easy to get physically to Washington as it is to be on a Zoom, but it means a lot to all of us to be able to see you all physically and hear from you. So thank you so much for the time, and thank you for Mr. Chair for having this hearing.
You bet. I'd like to give my colleague from Alaska, Ms. Peltola, the opportunity to introduce our first witness today.
Thank you, Mr. Chairman, Madam Ranking Member. Thank you for your the opportunity to just introduce our very esteemed Alaskan who is presenting before you. Dr. Galbraith holds degrees of experience with tribal organizations and currently serves as South Central Foundation's Senior Medical Director of Quality Assurance. In this role, Dr. Galbraith has worked hard to implement South Central Foundation's relationship-based NUCA system of care, ensuring high-class medical care is provided to more than 65,000 Alaskan Native and American Indian customer owners. Specifically, Dr. Galbraith has worked hard to expand the Alaska Native Medical Center's cancer service and screening programs, reshape the chronic pain program and OBGYN office, and critically, making services and programs operable throughout the pandemic. South Central Foundation has largely credited her leadership as a prime reason for their receiving the Malcolm Baldridge National Quality Award for Performance Excellence in 2011 and 2017, and for their consistently high standard of healthcare delivery. In recognition of her leadership, public health expertise, and years of service, last year Dr. Galbraith was awarded the Dr. Ann P. Lanier Meritorious Health Service Award by the Alaska Public Health Association. As you consider testimony today, I encourage you to pay particular attention to Dr. Galbraith and utilize the wealth of knowledge she brings to this and every conversation around public health and specifically healthcare delivery to our nation's Indigenous people. Thank you again for the opportunity to introduce my friend, Dr. Galbraith.
Thank you, Congresswoman. We appreciate you being here today to introduce her. Today's first panel is Catalina Villamontes. Is that correct? Okay. I'm going to mispronounce some names in here. I have a hard time pronouncing my own name a lot of times. Dr. Donna Galbraith and Esther Lucero. Is that correct? Okay. First up is Catalina. Yeah. Green light on?
Yes.
Okay, perfect.
Mm-hmm. Good.
Go.
Okay. Good morning, committee members. I am Catalina Villamontes, and I am the treasurer of the Board of Directors of Riverside San Bernardino County Indian Health Incorporated, located in Southern California. I am a member of the Pechanga Band of Indians, one of 9 consortium tribes in Riverside San Bernardino County Indian Health, and I also serve on the California Rural Indian Health Board. The health and welfare of my people and the Indian community served by Riverside, San Bernardino County Indian Health is my highest priority. Therefore, I'm honored to have the opportunity to testify today. First, I would like to start by thanking Congress for providing advance appropriations for the Indian Health Service beginning in fiscal year 2023. This mechanism will help our tribal health programs maintain consistency and continuity in our programs without the threat and disruption of potential shutdowns and continuing resolutions. Increasing the IHS budget. The fiscal year 2023 budget included a 10-year proposal to fully fund the Indian Health Service. Full funding meant raising the budget to approximately $36.7 billion. Only a year later, due to inflation and rising healthcare costs, that top line number has skyrocketed to $54 billion. Yet the total agency appropriation remains less than $10 billion. While we provide specific comments below, we cannot overemphasize the fact that our health programs are not adequately funded and patient care suffers as a result. If we are going to make good on the Indian Health Care Improvement Act's lofty goals of eliminating health disparities between Alaska Natives, American Indians, and the general population of the United States, we simply need more resources to do so. An agency created by the federal government based on existing treaties funded at one-sixth the level of need will continue to hold us back. We also need new resources to be made available through self-determination contracts and compacts rather than through grants, so all programs can benefit from the additional amounts. Doing so will also simplify the allocation and payment process and will ensure overhead costs are covered by the contract support cost appropriation. Simplifying contract support cost administration. We continue to support the full funding of contract support costs, the funding that covers our program overhead and administrative costs, so the program funds we receive can remain dedicated towards healthcare services in our Indian communities. We respectfully request the committee move the contract support costs and 105L lease appropriation subcontracts to the mandatory side of the budget, again providing greater certainty to our health care programs. We also ask Congress to simplify the IHS calculation payment and reconciliation of contract support costs to alleviate the significant burden on tribes and the growing bureaucracy at IHS necessary to implement current contract support cost policy. In response to full funding of contract support costs, both the BIA and IHS took divergent approaches to calculating the amounts owed. The BIA relied on tribal costs incurred and the federally negotiated indirect cost rates, whereas IHS added a number of carve-outs and caveats that complicated the calculations. Indeed, one of these lesser-known triggers in the IHS contract support cost policy was relied upon by the agency when it drastically cut the funding of the Fort Defiance Indian Health Board by over 90% in 2021. We support the enactment of H.R. 409, sponsored by Representative Tom Cole of Oklahoma, to protect tribal programs from such drastic reductions. We also asked the committee to order IHS to eliminate its burdensome reconciliation process, which happens years later after our books are closed. The amount of resources spent on the reconciliation process on both the tribal and IHS side do not make sense, given that our indirect cost rates adjust each year based on any over or under recovery. Increasing purchase referred care, PRC funding. I reside in California, one of the 4 Indian Health Service areas that are designated PRC dependent, meaning we have little or no access to an IHS or tribally operated hospital and therefore must purchase all or a large portion of inpatient and specialty care from non-tribal providers at a significantly higher cost. However, our current PRC funding is insufficient to meet the need for specialty care, especially without access to a tribal hospital. The result is that our patients are simply asked to go without the higher level care they need unless they have alternate resources. We ask this committee to provide additional PRC funding for PRC-dependent areas and to ensure that access to care is appropriately accommodated as resources are distributed. IHS is currently conducting feasibility studies regarding 2 new regional specialty care centers that are intended to alleviate the pressures on our PRC budgets without impacting our already scarce clinic share of PRC dollars. We support these facilities as to what they can bring to our patients and ask for prompt funding of any requests relating to these centers that may come before the committee in the future. We thank you again for your time and consideration.
Thank you. Dr. Donna Galbraith, you're next.
Thank you very much. I am from Alaska. I'm from the Mid-Tasca Traditional Council. I want to actually echo a lot of things that she said. So advance appropriations. Oops.
There we go.
All right. Thank you. Should I start over or I'm good?
Yeah, go ahead.
All right. I'm Donna Galbraith, as you've already heard, and I just want to thank everybody for being here and allowing us to testify. I am from Mid-Tasca Traditional Council in Alaska. I want to echo a lot of things that have already been said. I think that advanced appropriations are extremely important. They're critical to the stability of tribal health care, and we want to urge you to make this permanent, including the costs of inflation and population growth. Also, the pandemic has highlighted the need for healthcare workers across the nation, and tribes are no different, and actually in, I think, worse shape. We have had a 12% turnover rate for many, many years at South Central Foundation, but with the pandemic, it went up to a 25% turnover rate. And so you have burnout on top of that, and then you have workers that are left working extra hard, which increases the burnout. So it's a critical issue that needs to be addressed. Some things that the government can do is they can increase scholarships and also increase hiring and retention bonuses. In addition, Indian Health Service should look at working with organizations like South Central Foundation to establish training sites that will include programs like the Dental Health Aid Program and the Community Health Aid Program. One other thing is in some sites, especially in rural Alaska and other rural sites, there is no professional housing. And so you really can't recruit anybody there if you have no housing. So Indian Health Service should look at that and figure out, what are the housing needs in rural sites, and then look for funding to actually address that. One thing that I can't put enough emphasis on is the need for money for behavioral health services. This is crucial. We've tried to meet this need. We have integrated behavioral health into our primary care clinics, and that allows quick assessments and access to behavioral health specialists. We've also created programs, treatment programs, and behavioral health programs. So we have programs for pregnant women and women with children and adolescents along these lines. But the current funding right now, it had a little bit of increase in fundings, but it doesn't even meet the needs of the programs we already have in place. And there's a huge need to actually increase the funding overall so that you can spread out these programs throughout our area that we're serving. Also, the Indian Health Service has a program, it's called the Substance Abuse, Suicide Prevention, and Domestic Violence Prevention Initiative funding, and we would hope that this would be awarded on a formula basis as part of the provider's annual contract. Right now it's a grant, which means that all these tribes that need this funding have to compete with one another for this funding, and that is just, it's untenable, actually. It should be looked at. So the true cost of not having this funded is lost lives due to drug overdoses and suicide. Something needs to be done. We really appreciate the committee's 105L leases, what you've done there, and we strongly support that these costs remain part of the appropriation along with the contract support costs. The U.S. Supreme Court has told the Indian Health Service that they should pay for all of these costs in full, and they have, as you've heard, they've actually changed some of their rules, and so a lot of the activities and costs they're calling secretarial activities and refusing to pay for them when they've been paid for in the past. So we asked the committee to include language in the appropriation bill that would require Indian Health Service to calculate the FY 2024 contract support costs consistent with 2021. So I want to thank you for the opportunity to testify here, and I also want to thank all of you for all the work that you do. I appreciate it. Thank you.
Thank you, Doctor. Appreciate it. Esther?
Yat Bene, my name is Esther Lucero, and I am Dene on my mom's side and Latina on my dad's side, and I have the privilege of serving as the president and CEO for the Seattle Indian Health Board. It's actually an incredible honor to sit next to Dr. Galbraith, because the Seattle Indian Health Board has learned so much from the NUCA system of care, and we have work to really implement that integrated model. I feel like the only difference between our model and the NUCA system of care is that you actually have dentists incorporated into our team of professionals to serve our relatives, and also traditional Indian medicine apprentices. And so I want to thank you for that knowledge, and thank you for allowing us to build and grow on that. I'm honored to speak with you all today, Chairman Simpson and Ranking Member Pingree. And staff, thank you so much for always facilitating these Tribal Witness Days. They mean a lot to us. Seattle Indian Health Board is uniquely positioned because we have a public health arm, which is our Urban Indian Health Institute. And we are the only tribal epidemiology center that has a national focus because we serve all of the urban programs across the country. We also operate our community health center side, which is an urban Indian health organization as well as a federally qualified health center. We have learned many, many lessons from COVID. and that is we were able to expand access to behavioral health services through telemedicine. We were able to move very quickly to be able to support and meet the needs related to pharmacy services. We were able to build upon our strengths and just work really diligently to meet the needs of our people. I think we need to take what we've learned from those lessons, because you all have actually made the largest investment in Indian country than we've ever seen in our lifetimes. I want to thank you for that, but I want you to know that this is just the beginning. I'm here to talk to you about successes. You know, at the Seattle Indian Health Board, we've been able to open up 3 clinic sites in the last year due to these investments in infrastructure. That expands access. We're doubling the number of relatives that we are able to serve through that infrastructure investment. We need to see that continued growth. We've opened up 2 bricks and mortar clinics, and we also have a dental mobile unit, which Chairman Simpson, you'll be pleased to know, we purchased that so that we could actually serve our tribal partners in the state of Washington. We are blessed to work with our tribes. They recognize that as an urban Indian health program, we have a real value to serving our relatives. 76% of us live in urban areas. And so we have to meet that need. And at the same time, when our tribes have difficulties, you know, acquiring providers, healthcare providers, we know that we can work with them in partnership to help them meet that need as well. And so I want you to know that we are a valued component of the ITU system of care. It is through our tribal partnerships that we've been able to establish our ask, which is our increase to our urban Indian line item to $973.5 million. Right? We are rapidly moving towards a 10-year vision that's been established by our tribal partners in the Pacific Northwest. We want to realize full funding within 10 years. And so this ask is in alignment with that. And I continue to rapidly move forward to. I know that we're concerned about cuts, budget cuts. Please do not cut from the Indian Health Service. We're finally taking steps forward. Let's continue moving in that direction. I also wanted to let you know that access to 100% FMAP for urban Indian health programs has had significant outcomes. In the state of Washington, our state has reinvested that 100% FMAP cost savings into a tribal investment fund, and specifically added an urban Indian line item. So the 2 urban Indian health programs in the state of Washington each received $11 million. Let me tell you what we're doing with that money. We were able to purchase a 92-bed treatment facility, where for the first time in the state of Washington we'll be serving pregnant and parenting people with medically assisted treatment. There's a clinic that will be right on the same site, and that way we'll be able to provide wraparound services, right? That way we're not losing generations of our families to foster care systems. So we recognize our role and responsibility. What we need from you is continued investment so that we can meet those needs. That's why I'm here today. Not to mention just speaking to old friends. So thank you very much for hearing us, and thank you very much for supporting us as urban programs.
Thank you, Esther. Appreciate the testimony of all of you. A couple of questions. First of all, did you have, during the pandemic, there was created, and I'm not opposed to this, but traveling nurses, that they got much higher pay than the nurses that were actually at the hospitals and stuff like that, and it was just because of the lack of nurses that this happened. Did you find that same thing happening with Indian Health Services? Were there traveling nurses that
Yes.
came to Indian clinics and stuff?
Yeah, in the hospital at Alaska Native Medical Center, which we also are part of, we had to have traveling nurses. We just didn't have enough nursing staff.
Yeah.
And that caused quite a problem because of that, because they were paid a lot of money. So the nurses that we had that normally would, jump in and help, and a lot of them did, they really did. But it was hard because all of a sudden somebody who didn't know as much as they did or even understand the culture
Yeah.
was walking in and getting paid, 3 times the amount that they're getting paid. And it caused a lot of hard feelings.
Yeah, I have mixed feelings about that, but we did need those nurses and stuff, I mean, that's just a reality. But it is, nurses are one of the underpaid professions in this country, frankly.
Yes, I agree.
Catalina, you mentioned your PRC cost. As I understand it, you don't have a hospital.
Correct.
So your patients have to go to a hospital outside of Indian Health Services and stuff. And the cost is much more there.
Yes. For specialty care, hospital stays.
What do you do when you run out of money? Because, I mean, you're being paid, the rate you're being paid is the same as if you'd had a hospital, like some other
Yes, so
reservations do say.
we rely a lot on our third-party revenues, and yes, that's where the rest of the funding comes from, any third-party revenues that we can bill.
But is there any recognition in the payment schedule that you don't have a hospital, that you have higher costs out here?
Can you say that again?
Is there any recognition in the way that they pay the PRC that you don't have a hospital yourself, that it's you're having to send your patients to outside the hospitals that have higher costs?
Yes.
There is a recognition in that, so you do get more?
No.
No, you.
Actually, I couldn't. I don't know if I could speak to the CFO. He could probably answer that better, if that'd be okay.
Hello, everyone. I'm Mo Zayed. I'm the CFO.
Come up here for just a second so that they can transcribe it on the.
Okay. Okay, good morning, everyone. I'm Mo Zayed. I'm the CFO for Riverside San Bernardino County Indian Health. And yeah, so the issue with our PRC dollars is when we have to refer patients outside of our organization,
Right.
we have to find a way to fund those instances, and those healthcare costs are typically a lot higher.
Right.
So there really isn't a way to handle that other than to find some other way to obtain that funding. So what we do is typically we'll rely on third-party dollars, as Catalina mentioned, or we have to determine whether we need to cut services to our population, which is something clearly we don't want to do. So luckily we haven't been able to do that, or we haven't had to do that, but in the future we don't know whether that's something we're going to be faced with. So I think it's really critical to make sure that we get the funding we need to prevent that type of situation from happening.
Okay, thank you. And I also want to thank all of you for mentioning dental services, because I don't know if that means you've read my bio or what, but I was a dentist in the real world for 24 years, so I appreciate that. Thank you. Ms. Pingree.
Thanks so much for your testimony. I really appreciated hearing about it, and it's always good to sort of have that urban focus on how we deliver healthcare, so thank you. And I do want to just reinforce, you mentioned that competitive grant instead of, I don't know how we structure that or how much funding that would require, but I just want to reinforce that is so important, because we hear from virtually every tribal community about the very challenges around substance use disorder or domestic violence, suicide. These are just such three prime huge challenges, and to think that you have to just compete for the grant and it's not a given, it should be a sort of standard line item. So I'll make sure we focus on that and look for ways to do that. I think you both mentioned incorporating tribal medicine traditions and other things into how you deliver health, and I'd just be interested to hear a little bit more about how does that work? How do you and what kinds of practices do you tend to incorporate?
We do have a traditional clinic, and we have tribal doctors, and we treat it like a specialty. So we have to do referrals for that clinic just because we don't have enough tribal doctors. We're trying to expand the number that we have, especially because our tribal doctors are getting older, and we're worried that their knowledge won't be passed on. So we actually have a program where we're teaching a lot of people how, or they're learning, I shouldn't say we, because it's not me, but the tribal doctors are teaching these students on how to be a tribal doctor. But that's a slow process. It doesn't happen overnight, but we're working at that. And like I said, it's like a specialty service because we just don't have enough access there. A big part of the problem is, you can't bill for those services. It isn't recognized as a service, but for many people, it's a part of, our belief system. It's part of our healthcare system. It was how I was raised. The first time I went into an emergency room, I was going, people come to the emergency room for this? Really? My mom just did this, and she would do different things. So yes, it's an integral part of how we deliver services, and it's really important for our people too.
Thank you for the question. This is something the Seattle Indian Health Board is really proud of. We're actually working on, we have a 2-year pilot to actually move traditional Indian medicine services to billable services. And we were funded by the state of Washington to be able to develop the system to make it a billable practice. So what we've done is we've actually adapted our electronic health record system to incorporate traditional Indian medicine practices. Although we're very careful to make sure that we don't share too much information so we don't compromise the integrity of the practice. It's very important that, our indigenous knowledge is protected. We are currently working on our credentialing system. The way it works within our program is we have a traditional Indian medicine apprentice that's part of the panel teams that provide direct services. Now, apprentices, they act as natural helpers. So I don't know if folks are familiar with like a sweat lodge, for example. You have a traditional Indian medicine practitioner, the doctors that my colleague here is speaking of, but you have a helper, like, who collect the wood, who keep the fire, who pour the water. And so our traditional Indian medicine apprentices are able to do that. Mm-hmm. It's very similar to on the behavioral health side where you can do prevention, early intervention work. You can do a quick assessment and then you refer to a traditional Indian medicine practitioner. So we are actively working on the system because we were told it couldn't be done. Mm-hmm. And we are proving that, in fact, it can be done. So we've actually developed a coding system. Now, once we complete the credentialing system, we can actually we'll be able to share a year's worth of data on impact. And so for us, we know that strengthening cultural identities is really the key to health within our communities. And this is something we learned from you. Yeah, so thank you.
So I won't keep asking you questions about this, but when you say it's not a billable service, is that an IHS billable service or a third party? Both.
Both, yeah.
Both. So I just, it'd be great to stay in the loop about what you're doing because I'm curious about how, I know, in some states, like you said, it was state money, the practices that are allowed under billable services can be greatly expanded. Mm-hmm. I mean, my state allows for naturopaths and, other things that are considered non-traditional medicine, sorry, non-traditional music. But anyway, so I think it would be interesting to see how we increase the gray area a little bit here so that, because we hear lots of testimony about how important it is for young people to stay connected to their culture, how important it is in substance use disorder treatment, just all the things, the beneficial values. So perhaps we can expand that more, or at least make sure it's encouraged, not
If I could just add one thing. We've actually had 3 managed care organizations agree to pay for traditional Indian medicine as a value-added benefit. Community Health Plan of Washington specifically has agreed to pay at the full encounter rate. So this is something they recognize, right? Because in the end, what it does is it creates cost savings. We have healthier people, right? Less cost.
Mm-hmm. Great. Well, thanks for your good work. Thank you very much.
Thank you, Ms. Pingree. Representative Zinke.
Thank you, Mr. Chairman. I appreciate the long travel of all, because I know D.C. is not exactly the easiest place to get to, but I appreciate it. And I didn't realize how bad BIA was until I was in charge as secretary. So I do recognize there's large issues. I also recognize that we have treaty obligations, and a promise made should be a promise kept. Mm-hmm. We also have other obligations. We have an obligation to make sure our borders secure. Montana has got a lot, and I haven't asked you about a lot of problems with drugs, primarily coming up from the southern gut. So there's an obligation to make sure that we protect our borders and make sure we also create conditions where we have prosperity and economic conditions. I would imagine in Montana, when the government says inflation, because everyone's looking at the budget and everyone's going, we're coming up short, right? And Montana, the government says if inflation is 8, Montana's a little higher because distances are longer. I'm curious, Doctor, in Alaska, one is inflation has to be a concern because you're already elevated costs of food, gasoline, fuel on top of that, so the wages are tough. And then add an inflation on it, probably, Alaska probably. How concerned are you just to keep up with your budget today, and then you got to add in maybe 15%? How concerned are you about the inflation part and how it affects your budget?
I'm concerned about it. as you said, everything across the board is costing more money. And then all of us have had to increase the wages that we're paying our staff just because, the competition out there is so high. So it's, we talked about the nurses, but, because there's a shortage of healthcare workers nationally, we've had to actually, compete with other people trying to hire. So you have a limited pool, which actually drives up the costs, and so that adds an inflation cost. Plus, just the cost of healthcare is, it goes up astronomically. Look at medications and the cost of those and new treatments and how expensive they are. Yes, it's a huge problem. And then, you've already mentioned, the cost of living and, housing, food, clothing, all that stuff, the costs have gone up, and we aren't directly involved with that, but we're involved with the other aspects, and we're involved with helping people navigate, the social aspects that they will need help with. There's a lot of different people who, are experiencing homelessness, and how do we help those folks as best we can? So it permeates everywhere. It's a huge problem.
So if I could, Mr. Chairman, Esther, we hear a lot about the VA. The VA seems to be gets a lot of attention. Indian Health Service gets ignored.
Yes.
Is it fixable?
It's interesting that you bring up the VA because I really feel like the Indian Health Service should be treated similarly, right? That's where advanced appropriations comes in, mandatory spending. The VA actually does have billable services for traditional Indian medicine, right? And so, yes, I do believe it's fixable. I feel like we're on the right path. We've taken the first steps. And if we continue on this path, we'll continue to support the needs. I agree with Dr. Galbraith that, workforce development is really key, right? We have 28 different training programs. And I agree that being able to have this investment in Indian country, we've been able to support folks with sign-on bonuses, hero pay, like those types of things that really make it possible to retain our staff. And it helps us stay competitive, with this inflationary environment. I do believe it's fixable. We need your help.
Last question. Catalina, you mentioned third party. Is a lot of the third party from the casino side, or where are you relying on the third party to make up the costs?
The tribes that are in a consortium that have private insurance that we can bill. And yeah, most of those are the casino tribes.
Okay. Thank you.
Mr. Elsey.
Thank you, Mr. Chairman. I just have a couple of quick questions, mainly for Dr. Galbraith. Are you a specialist as a doctor? And if so,
Family practice doctor.
family practice doctor. How many people do you service?
Over 65,000.
65,000. How many doctors are in that clinic?
We have several clinics. We have two main clinics. The main one is in Anchorage, and then we have one in the Wasilla-Matsu Valley, and then we have 55 rural villages that we serve.
Okay. And how many doctors in those three clinics?
Oh, doctors, I actually can't tell you. I can tell you that we have probably 125 providers.
Okay.
So that's physician assistants and nurse practitioners along with MDs. And
Is that enough?
we're recruiting more. Well, despite all of these things that I've been talking about, our population continues to grow and the need continues to grow. So we continue to recruit, different people to fulfill the needs.
And so housing's an issue, right?
Yeah,
So
housing's an issue.
So, and by housing you mean
In rural communities.
no
There-
houses
no-
at all?
Yeah, we try to work within the communities where we're at to find housing and rent housing from the local area, but it's not always possible. Or get land where we can actually build something, but then you need funding to do all of that. Some places don't have any housing whatsoever, and then so you just have to kind of, piecemeal things together.
Would you retire if you could? And if so, how long is it going to take? Because if you don't have housing for people that you're trying to recruit, you're not going to recruit anybody. So the people who are already there can't leave. And it seems like in the last couple of days, it seems everybody who's testified before us seems to see it as their duty to continue to serve their communities. And so it seems like they'll do it for as long as they can, but they're trying to find a hard time for the next generation to come in to do the same thing. Is that fair? Is that a fair assessment?
I wouldn't say it's fair, but I would just add in that there's burnout is real. There's a lot of people who are having a hard time staying working, even Alaska Native American Indian people who are employed. And we try to, we preferentially hire Alaskan Native and American Indian people. So we have about 55% of our staff.
Okay. And for you personally, what are the top two problems that you see, people coming to your clinic that aren't just normal checkups? What are the emergent issues that come to you every day, the top two?
I would say, well, substance abuse is a big one, and
Okay.
then I would say respiratory disease, just across the board as a big category.
And what substance specifically that is the worst one? Meth. Okay. Okay. Thank you all very much for your time. I yield back.
Thank you, and thank you for being here today to testify. The housing is an issue that is across the country.
Yes.
Every place that we've visited, trying to recruit people, whether it's teachers or doctors or anything else, to these locations, if they can't find a house, they're not going to come because they can make a better living somewhere else, and that's where they go. So, I mean, it is a huge issue all across this country. So I appreciate your being here and your testimony today. It helps us put together this bill, and I do want to say, several of you mentioned the work that has been done over the last couple of years to increase the funding for these programs, and I just want to say most of that, and in fact all of that, has been done by this committee led by Congresswoman Pingree, and we appreciate having been able to do that over the last few years. So thanks for your recognition of that, and thanks for recognizing Dennis. Okay. Yeah, that's right. Mark LeBeau, Francis Crevier? Okay. I was going to say that, but my French isn't very good, and that sounds kind of a little bit of French. And William Smith. Now, there's a name I can pronounce. Yeah, I was at Star. Okay, thank you all for being here today. Mr. LeBeau, you're up.
Good morning. Thank you, Chairman, Ranking Member, and committee members for providing me the opportunity to testify this morning. My name is Dr. Mark LeBeau. I'm the CEO of the California Rural Indian Health Board, CRIB for short. CRIB was established way back in 1969 and provides comprehensive health care support to 19 tribal clinic systems in rural and frontier regions in the California IHS area. We are sanctioned by 59 federally recognized tribal nations out there to support and do the best that we can to improve the health and well-being of American Indians, Alaska Natives, and tribal members within the California IHS area. As you know, committee members, American Indians, Alaskan Natives continue to experience the worst health inequities of any ethnic population in the nation, right? We're definitely aware of that. Recently, HHS reported that American Indians suffer from significantly higher health disparities in relation to depression, suicide, obesity, substance abuse, hepatitis, infant mortality rates, death of Indian babies, and diabetes than other populations. On behalf of the tribes and the tribal clinics that I work with through CRIB, these are our requests. Number one, we urge the committee to fully fund the IHS agency and ensure each IHS area receives an equitable amount of the resources. Fully funding IHS honors the federal and trust responsibility to tribal governments. In 2022, the National Tribal Budget Formulation Work Group calculated full funding for IHS to be a little over $51 billion. $51 billion. However, the fiscal year 23 IHS numbers came in at $7 billion. So quite a big difference. Long way to go to strive to meet the health and service needs throughout the IHS system. This lack of funding has a direct correlation with the higher rates of premature deaths and chronic illness suffered throughout Indian country. Request number 2, ensure current IHS funding is distributed equitably. CRIB has testified before about lack of fundamental fairness in IHS budget allocations across the 12 IHS areas. According to the IHS 23 Congressional Budget Justification document, the California IHS area received the fewest or second fewest funding resources on a per-patient basis across the 12 IHS areas. This is true across nearly every IHS budget line item, including dental health, alcohol and substance abuse, public health, nursing, mental health, health education, community health representatives also. The list goes on. One of the specific budget line items at the core of this problem is known as what's called the Facilities Support Account, or FSA, Facility Support Account. The staff provided by FSA funding are responsible for collecting data and identifying deficiencies at IHS facilities and in tribal communities. They also provide technical assistance to the tribal clinics and draft facilities projects based on community needs data. Many of these facilities projects are retained until funding opportunities prevent themselves. When an IHS area is starved of the SFA funding, it does not have the ability to effectively carry out any of these duties. And up until this year, the IHS provided the California area with the fewest FSA funding of all 12 IHS areas. Tribes in California committee members have coined a term, ABC, anywhere but California where IHS funding goes. And tribes in California have the same responsibility to provide care, the same government-to-government relationship. So why is it that they're chronically underfunded across nearly every IHS line item? We need your help, committee members. Really appreciate Chairman Simpson's dialogue with Catalina Villamontes from Riverside San Bernardino Indian Health a moment ago about purchased and referred care funding. Critically important mechanism for tribes in California. The California area has decided not to fund any IHS ambulatory facility in California for over 40 years. Not only are there no IHS hospitals in California, IHS has also never provided funding to construct and staff tribal clinics. Riverside had to find the dollars to build their own. Anav had to find the dollars to build their own. All tribal clinics were built on the backs of tribal funding, third-party revenue, cobbling together grant funding, foundation dollars to build tribal health facilities in California to assist IHS in fulfilling its trust responsibility to provide health care to tribal communities in California. Definite example of inequitable funding. So the need for at least purchased and referred care dollars is critically important. There is, Chairman, within the IHS PRC funding methodology, one factor that was put in place by tribal leaders long ago. It is known as the PRC dependency factor. There's 3 categories of funding within the IHS methodology. Guess where our PRC dependency factor is located? Last on the list, right? Anywhere but California. So we're third. Once all the dollars come in and are appropriated and allocated, fills up the first bucket for base funding, second for population inflation, third for several factors, including our little PRC dependency factor. Once in a blue moon, committee members, that PRC dependency factor is resourced if there's enough money put into the budget. We're asking our congressional leaders to include a unique consideration for those areas that are PRC dependent, like California, like our relatives in the Northwest Portland area and 2 other areas. So that's one of the recommendations we're making before committee also.
Okay.
I will respectfully submit, Chairman.
Great. Thank you, and thank you for your testimony. Francis, you're next.
Good morning. My name is Frances Crevier. I'm Algonquin and the CEO for the National Council of Urban Indian Health. We are the national representative for urban Indian organizations, also known as UIOs, within the IHS system. On behalf of the 41 UIOs, I would like to thank Chairman Simpson, Ranking Member Pingree, and members of the subcommittee for your leadership to improve health outcomes for Indian country. We know all of you are working hard behind the scenes to help us achieve advanced appropriations for IHS, and thank you for that meaningful step forward. And congratulations to you, Chair Simpson, on your return to this subcommittee. In these 2 days, you will hear from 65 Native leaders that are taking time away from their people to tell you how you can help address the needs of their communities. We know that you can't create solutions to our needs without the support of your colleagues, so we ask that you share our message with those who are not present to ensure that we are heard. Many of you have stood up as champions for us, and we're calling on you to implore your colleagues to join us as we are fighting for our lives. The statistics I'll talk about today should set off alarm bells for policymakers. Our people, your constituents, are dying from very preventable deaths, and we need your help. This Congress has the power to right wrongs of the past and move in the right direction and literally save Native lives. You have the power to fully fund IHS at $51 billion. There are two staggering statistics that keep me up at night. We know that researchers and scientists express grave concern when there is a shift in life expectancy by even 1/10 of a year, and Native life expectancy has not only decreased by 1/10 of a year or even 2/10 of a year, but by almost 7 years. Despite all of the latest technologies and medical advancement, our life expectancy is the same as it was in the US in 1944. We are not living longer and have the worst health disparities in the United States. The past few years have impacted our Native children forever. Over the course of our pandemic, our children lost their caregivers at staggering rates. One of every 168 Native children experienced orphanhood or death of caregivers, meaning Native children were 4.5 times more likely to lose a caregiver. For every one white child caregiver lost, there were almost 5 Native child caregivers lost. That means our children are without their mothers, fathers, aunties, and ultimately the support that is central to thriving communities. Our suicide rate has also increased 26% from 2018 to 2021, and we are the highest in the nation at 33%. Our Indian health providers are doing everything they can to lift up children and families, but we need full funding to help solve this crisis. I know many of your colleagues in Congress believe IHS already gets enough. Yet increases in funding of similar agencies often outpace those of IHS, and IHS has never been properly funded. The increases provided by this committee, very much appreciated, are frankly not nearly enough. Gruesome statistics I cited are a result of incremental increases to a historically and chronically underfunded budget that aren't nearly enough to begin addressing these jarring disparities. We constantly hear blame for IHS, but how can you blame an agency that was not set up for success, funded at less than 10% of need? For over 50 years, without advanced appropriations, mandatory or full funding, our providers have been operating without a full budget or budget certainty. Why would anyone ask Indian health providers to operate knowing they will not be able to pay their doctors on time because of late payments due to DC politics? How do you expect IHS to really address these awful statistics? How can they continue to be hubs for innovative solutions for our communities? The answer is full funding. IHS has never been able to operate to their fullest capacity because they only have 10% of what they need. Although our providers are great stewards of the funds they can access, it is not enough to care for our communities in the ways that we deserve. A fundamental shift must occur so we can begin to address the issues I bring to you today. Decades of IHS being underfunded has led to the worst health disparities in most of Indian country. Yes, we are resilient, but that does not mean that the government can allow Indian health to remain underfunded. Native people deserve full, healthy lives, and we cannot continue to rely on short-term solutions that can only address symptoms of a problem. So we ask for full funding for IHS and the Urban Indian Health line item. Make advanced appropriations and 100% FMAP for UIOs permanent. Protect us from sequestration. And you've heard from our Seattle UIO on the last panel on how the investments from Congress can expand services tremendously. So you have the power to steer this ship and stand on the right side of history. Together we can get it right this time. Thank you.
Thank you. William.
The issue, Chairman Simpson and Ranking Member Pengree and the distinguished members of the subcommittee, on behalf of the National Indian Health Board and the 574 sovereign, federally recognized American Indians and Alaska Native tribes we serve, Awa'ata, thank you for the opportunity to provide testimony on the Indian Health Service. Adukte, my name is Chief William Smith. I am the chairman of the Alaska and the Alaska Area Representative of the National Health Board. I am a Vietnam War veteran, a retired Army sergeant, and I'm proud to serve my country and I continue to do this through serving tribal nations through the National Health Board. According to the recent CDC report, the life expectancy for American Indians and Alaska Native has declined by nearly 7 years, bringing our average life expectancy down to 65 years. The national average in 1944, like you just heard. I don't know how many of you here today are over 65. I am. But we're beating the odds from where I'm from. Just like our life expectancy, the Indian health spending is stuck in a termination era. The Indian Health Service budget may appear to have increased since 2009. But when you consider inflation and population growth, the Indian Health Service budget has remained relatively flat for decades. We saw this crisis play out in the worst way during the COVID-19, and now we see it in our data. We cannot expect tribal community health to improve when they're constantly starving for resources. Spending to combat the pandemic resulted in a historical one-time investment in the Indian country. Congress's swift action saved lives. Democrats saved lives. Unfortunately, the Indian Health Service is so underfunded that it covers less than the estimated need for the Indian Health Service in a single year. Congress provided more than $1 trillion for federal health care each year. It chose to underfund the Indian Health Service in fiscal year 2023. Only 0.66% of the health and human service funding went to the Indian Health Service. Surely this cannot be the highest possible health status promised by the United States and in the Indian Health Care Improvement Act. The Indian Health Service need-based cost estimated in 2024 is about $51.4 billion. And the cost estimate for 25 is about $53.8 billion. The Indian Health Service National Tribal Budget Formulation Work Group worked to develop this estimate of funding each year. National Indian Health Board supports the tribal-driven database cost estimate in justifying the National's Tribal Budget Formulation Work Group for the Indian Health Service. Additionally, the Indian Health Service spends should be provided through mandatory direct appropriations. But until that time, advance appropriations for the Indian Health Service are considered with the trust and treaty obligations of the United States. Congress should expand advance appropriations to all the Indian Health Service accounts. Keep advance appropriation in place until the Indian Health Service spending is mandatory, the way it always should have been. There has been lots of discussion in Congress about the potential cuts or budget control measures for the federally spending. Indian Health Service must be held harmless. Indian Health Service funding is so small in comparison to the national debt that cutting Indian Health Service would not result in any meaningful savings in the national debt, but it would devastate tribal nations and their citizens, funding at less than 1/6 of the duty owned in 2023. Finally, I would like to highlight the critical need for renewal of the Special Diabetes Program for the Indians this year. Although I understand this is not under the subcommittees or as a mandatory program, Special Diabetes Programs has been one of the most impacted programs to reduce the incidence and impact of type 2 diabetes ever created. It expires on September 30th of this year. Please work with your colleagues to authorize committee to support the permanent renewal of this program at the funding amount at least $250 million. Special Diabetes Programs saves the Indian Health Service, and it saves on Medicare. Conclusion, you can break this cycle. You can stop terminating our people. The Budget Committee and Appropriation Committees must put the spending caps in place to grant our request, and the subcommittee must prioritize Native lives. Together, we can do better for tribal nations and Alaska Natives and American Indians. And we talked earlier about the VA and the Indian Health Service and third-party billing. In Alaska, we decided to do the MOU to help, but there is still a big issue that needs to be done between the Indian Health Service and the veterans to take care of American Indians and Alaska Native veterans. But also, when we did the MOU in Alaska, we take care of all our veterans, no matter where they're at, serving over 200 clinics in the state of Alaska where a veteran can be treated closer to home and get reimbursed, because the MOUs are one thing, the reimbursement agreements are the important part of that. Reimbursement for the health care that's being shared and for the pharmacies. And the pharmacy reimbursement needs to be fixed between the Indian Health Service and the VA, because the Indian Health Service has one list, and the VA has another. They need to work together. So if my Indian Health Service doctor says, I need this medicine, and it's not on this list over here, that the VA doctor says, well, we don't treat it with that. We need to make sure that's scrubbed and compromised.
I appreciate that, William, and thank you for your testimony, but you're suggesting that agencies of government work together?
Ever since I got,
They coordinate with each other, that kind of stuff?
and it's got to start, because look at history. What happened when we tore down the wall in East Berlin? Countries started working together. If we can tear down our towers between the Indian Health Service and the VA, and I tell them all the time, every time I meet with them, we need to work together to take care of our brothers and sisters. That's already served.
I've been trying to do that in a lot of different arenas, to tell you the truth. It is hard to do. I mean, there are no more stovepipes than there are in government. And trying to get federal agencies to work together, whether it's the Forest Service and the BLM or whether it's the Department of Energy with some of their sub-agencies and stuff, it is a tough thing to do. But you're right. I agree with you fully on breaking down those barriers. Now I forgot what the hell I was going to say, but I do. I was going to. Most people don't know that American Indians have a higher diabetes rate than any other population in our country. And when they talk about, they want to do traditional Indian therapy like sweat lodges and stuff like that. You know what? There's some things Indians did years ago that were healthy practices that they were engaged in. And what we found out is that, not we found out, we've learned from the tribes that have started practicing this, you can reduce the diabetes rate by going back to your traditional foods.
Agreed.
It's amazing how that has happened in South Dakota and other places that I visited and stuff. And so there are traditions that Native Americans use that are what are called their traditional health care, that some of us don't recognize. But from all of your testimony, and sitting here on this committee, yeah, we got a national debt. We all recognize that, and we've got to start addressing that and stuff. But you're right, health care is something that we shouldn't necessarily be slashing and burning. And particularly when you look at the amount of money that has been spent over the years that we traditionally spend for veterans health care per person versus the rest of the population versus Indians. The disparity is huge. And while I don't like to say this, I will tell you in all honesty, Indians haven't been a priority over the years. We have begun to address that. It takes a while to do that, but we're working on it, believe me, we are. And it is a concern of the members of this committee, and we will continue to do that. We're going to get an allocation from the Budget Committee that we're going to look at and go, wow, it's kind of ugly. So we're going to have to make sure that we prioritize Indian health care in these budgets. When I met with the staff, I mean, I'm back as chairman after years being on energy and water, and when I met with the staff and we talked about what are we going to do when we get a budget that requires 25% cut. There are some areas we're going to have to protect. Indian healthcare is going to be one of them, I think. So, anyway, thank you for all of your testimony. We appreciate it very much. It is near and dear to the hearts, and one of those things that's absolutely necessary as far as I'm concerned. So, I appreciate it. Ms. Pingree.
Yeah, and thank you very much, Mr. Chair, and thank you so much for making that commitment, because I know this, the allocation of this committee is never high enough. This year could be scary.
Yep.
And protecting Indian health is critically important, as is housing and education and so many other things. But meeting our treaty and trust obligations is just so critical, and I'm so pleased how committed you are to doing that. So it's good to be working with you at this moment in time. Thank you all for your testimony, really important information for all of us, and so many of the things that you're asking about, absolutely important to protect the special diabetes program. I concur 100% on that. And actually, I introduced a prescription program that's being tested in Indian country, and it's basically to deal with what the chair said, to make sure people have access to healthier fruits and vegetables, because so often people are in food deserts or they just don't have the cash. It's easy to say we should eat more healthy food, but unless you get, which this program gives you a script from your provider that you can take and use to buy fruits and vegetables. So we're looking forward to seeing the expansion of that, just being tested out now. But most importantly are the numbers that you're talking about. I mean, the idea that the budget is, what did you say, 7 billion? It should be 51. So we just have to take a big leap at getting closer, because you and the centers you represent know how to distribute and spend that money and know how to make sure we get access to it, and that you can use it in the ways that's most important for you. But I do think this recurring mention of the comparison to the VA and to our tribes, and the fact that we've have not paid enough attention and had that as a priority. I sit on VA Appropriations Subcommittee too, so I'm going to see if we can't do a little study of per capita. How does this work out? Because sometimes I think our colleagues need to see the numbers and say, you know, we all understand why our veterans are a priority, and thank you for your service. We know that Native Americans serve at a higher percentage than the rest of our population, yet we are allowing these huge disparities, and I'm sure the numbers are going to be staggering. And I want to learn more about the memorandum of agreements and the other things that we have where we can use the funding that the VA has to make sure that it's used at a level appropriately, and that, you know, you can get the prescription drugs your provider suggests, and it all is paid for by the VA as it should be. So thank you all. We're learning a lot today, and your important information about equitable distribution seems really critical. So I'll try to understand that better. Great, please do. Thanks.
Thank you. Mr. Elsey?
Hard to follow you, Mr. Chairman.
No. Thank you very much. Mr. Kilmer, okay. I appreciate all your testimony, I really do. It is heartfelt, and we know that it is heartfelt, and we know that it comes, you're very serious about this, and we want to help you deliver the health services that our Native American brothers and sisters need in this country. So thank you. Appreciate it.
Awata. Thank you.
You bet. Next panel, Linda Austin, Ryan Hendricks, and Dr. Tony Tistok. Don't know if that's close.
They call us EX, but CEX call ourselves the hunt. Yeah, my mother was the last full-blood Indian. Thank you.
Pretty damn close. Linda, you're first. Green light. There you go.
Thank you, Mr. Chairman. My name is Linda Austin. I'm the Chief Operations Officer for the Isleta del Sur Pueblo in El Paso, Texas. But I'm here today representing the National Tribal Contract Support Cost Coalition. The coalition is a voluntary organization of 20 tribes and intertribal organizations that collectively operates several $100 million in IHS and BIA programs on behalf of over 250 tribes. As the subcommittee is well aware, prudent and audited contract support costs are the backbone of tribal contracting and compacting activities in Indian country. For this reason, we are grateful for the committee's continued action in seeing that these fixed costs are annually reimbursed through an unlimited appropriation. After all, without the current CSC appropriations, tribal governments would be unable to operate their programs, at least not without massively cutting program operations to cover our overhead costs. Today, the problems tribes confront in this area are by far the product of agency shortcomings, not neglect from Congress. I would therefore like to highlight 6 areas of necessary improvement. First, we respectfully ask Congress to free tribes of the costly, impractical, and non-statutory reconciliation process that the IHS has been imposing on tribes. These reconciliations are unnecessary, the BIA does not conduct them, and the IHS should stop this practice. After all, tribal expenditures are already independently and annually audited, and the government has remedies, such as the Contract Disputes Act, for any mis-expenditure of funds. Moreover, when an audit for a given year is completed, a separate reconciliation process already occurs by federal agencies through the indirect cost rate setting process. This is why the BIA does not add another reconciliation layer. As a solution, we respectfully ask the committee to streamline appropriations language and bring uniformity between the IHS and BIA contract support appropriations by simply declaring that once CSC has been paid, these funds remain available until expended without further justification. My written testimony includes language to accomplish this result. Second, we ask the committee to move the CSC and 105L lease accounts to the mandatory side of the budget, as has been requested by previous witnesses, to ensure these operational funds are available and timely paid. Third, both agencies are so deficient in making timely CSC payments that we believe the time has come for Congress to either charter a tribal federal task force to find out why and what is the problem, or direct GAO to look into this. BIA and OSG routinely fail to pay some tribes for months and even threaten non-payment if sudden year-end agency demands are not met. For its part, IHS delays in reimbursement of CSC to support pandemic-related funding was shameful. Internal agency guidelines are supposed to expedite payments, yet the agencies too often ignore those guidelines. Fourth, the coalition was deeply alarmed by IHS's position that it could unilaterally reduce contract payments to tribes in the wake of a recent misguided court decision known as Cook Inlet Tribal Council versus Dodomain. Although a federal judge swiftly blocked IHS's unlawful action, the entire episode highlights the need for a congressional response to this concerning decision. Members of the committee will be interested to know that Congressman Cole and a dozen co-sponsors have introduced a bipartisan bill, H.R. 409, to do just this. And we hope that all members of this committee will become co-sponsors in the coming weeks. Fifth, the BIA and IHS continue to ignore their statutory duties to report to Congress on the execution of their contract support cost obligations. To be clear, this is a statutory mandate, yet each year the agencies fall further and further behind on this report. Resources spent on unnecessary reconciliation processes and information demands are far better spent on telling Congress exactly what it is the agencies are doing with the CSC appropriations. Sixth, IHS continues to award key health program funding as grants instead of contract amendments. Doing this bypasses the mandate to pay CSC on these programs. It defies 2 tribal consultations that the last administration held on this issue, and it forces program reductions to cover the fixed overhead costs of running these programs. These are programs of special urgency that you've heard, addressing things like substance abuse, domestic violence, opioid and methamphetamine, and suicide. We therefore ask the committee to mandate that upon tribal request, IHS add these programs to tribal contracts and compacts. Thank you for the opportunity to testify today on behalf of the National Tribal Contract Support Cost Coalition.
Thank you, Linda. Next is Ryan.
Good morning. Good morning, Chairman Simpson. Oh, there we go. Thank you. Good morning, Chairman Simpson, Ranking Member Pingree, and members of the subcommittee. I'm Ryan Hendricks, the 6th councilman of the elected government of the Quinault Indian Nation. Quinault Indian Nation is located on the southern corner of the Olympic Peninsula in Washington State and abuts the Pacific Ocean. So my testimony is going to focus on the 3 following priorities today. Funding for tribes to address the many negative impacts of climate change and what we're doing in our relocation efforts. Number 2, to the funding to address the unacceptable rates of missing and murdered Indigenous women in our country. And number 3, the advanced appropriations for Indian health services. There's 2 major villages located in our reservation, the village of Queets and the village of Tahola. Both have been significantly harmed and continue to be threatened by climate change. In response, our tribe has developed a 3-phase master relocation plan for the village of Tahola. And I'm happy to report here to the subcommittee that we've currently completed about 53% of our infrastructure for Phase 1, and we're currently working on the next steps to kick off Phase 2 and Phase 3. Phase 2 will be mostly government buildings and a little bit more residents. Phase 1 is mostly residents. The total cost for this project is about $400 million. In addition to Tahola, we've identified the land and secured the land for our Queets relocation. The next step is a master plan for Queets, but until we get the master plan completed and funded, we still have no idea for a projected cost for moving the village of Queets. So we respectfully ask for the assistance from our trustee, the federal government, to help fund the tribal climate resilience programs at $61 million in fiscal year 2024. This funding will help Quinault and other coastal tribes in combating the higher sea levels and the increasing weather caused by climate change. Late last year, Representative Kilmer introduced the Honoring Promises to Native Nations Act. The bill would implement the recommendations laid out by the U.S. Commission on Civil Rights. A 2018 report evaluated the federal government, whether it has met its trust and treaty obligations to Native nations, and it determined that the government has systematically failed to honor its promises and trust responsibilities. We respectfully ask that once the Honoring Promises to Native Nations Act has passed, we request the subcommittee to fully fund the many grant programs offered inside it, including programs for Native victims of crime, victim advocates for Native victims of all crimes, a national Indian country clearinghouse on sexual assault, funding for housing, and funding for related education programs. But I'd really like to thank the subcommittee and Congress for taking the historic action to ensure that Indian Health Services received advanced appropriations for fiscal year 2024. These appropriations will help ensure that Indian Health Services are protected from disruption or delay. This has been a top priority for Quinault as previous government shutdowns or delays have disrupted Indian Health Services to tribal citizens. We respectfully request that the subcommittee include advanced appropriations for fiscal year 2025 Indian Health Services at a minimum of $4.6 billion as part of the fiscal year 2024 Interior, Environment, and Related Agencies Appropriations Bill. Quinault's taken the necessary steps to build a brighter future for our people, to build better lives, and to create opportunity in our reservation. But we can't do it alone. We urge the subcommittee to honor the treaty and trust responsibilities to Quinault and to support the above request as well as the request of the National American Indians of Congress and the affiliated tribes of the Northwest Indians. Again, I humbly thank you for allowing me to sit in your house and testify on behalf of my people, the Quinault Indian Nation.
Thank you. Doctor?
Chairman Simpson, Ranking Member Pingree, and esteemed members of the committee. My name is Tony Sitoke, and I'm the Executive Director of the Kiowa Tribal Education Agency, speaking on behalf of Mr. Lawrence Spotted Bird, Chairman of the Kiowa Tribe, to address critical issue of adequate resources to support tribal nations in their support of quality education and improved health care for their tribal citizens. I want to thank you for this opportunity to provide testimony on behalf of our chairman, who was unable to participate in person because of pressing urgent issues back home. I'm speaking before this body today as a living example of the guidance and influence of our tribal colleges to help shape the lives of our young Indigenous students, to prepare them to assume leadership roles within our tribal governmental systems. I attended Haskell Indian Nations University and graduated with a degree in education in 2002. After experience childhood in the small rural community of Carnegie, Oklahoma, home to the Kiowa tribe. My rural education may not have prepared me for the rigors of higher education, but my life among our broader community instilled the core values of our Kiowa people: to be strong, to be persistent, to work hard, to be resilient.
After receiving my terminal degree from the University of Oklahoma, with the assistance of the Kiowa Tribe's Bureau of Indian Education Higher Education Program, I was prepared to make my way in this world fully equipped to confront the educational challenges of our people. So I present this oral testimony before you this morning, validating the wonderful opportunity given to our Native students with the resources provided through the Bureau of Indian Education to be the best that we can be. Tribes throughout Indian country have made tremendous improvement in supporting educational opportunities for their tribal citizens because of the emergence of gaming resources, which supplement the support provided directly by the Bureau of Indian Education Scholarship Program. This financial support is derived from the recognition tribal leadership provided to the pursuit of education among its youngest citizens when negotiating relinquishment of tribal land bases through the process of treaty making in the early years of colonization. Our Kiowa chiefs and representatives negotiated these important conditions in the landmark Medicine Lodge Treaty of 1967, which required the provision of schools among the tribes and have been a critical element of these treaties and compacts ever since. Our Kiowa leaders realize the importance of education for our youngest citizens that continues to remain at the forefront of our government-to-government relations to this day. The BIE scholarship program is pivotal to the educational journey of our Kiowa people and needs more funding to build on its success in providing access to higher education. We realize the essential mission of this program can make a real difference in the lives of our Kiowa citizens. We realize the practical financial support this program provides can be the life support necessary to sustain the educational journey of the best and the brightest our tribe has to offer. We realize the urgency of this program can help to alleviate the burden of struggling to survive in an uncaring and unsympathetic world. Therefore, we urge full support of this committee to increase funding for the Bureau of Indian Education in fiscal year 24. The functions of a tribal education department are critical in the educational journey of its youngest citizens to provide the development of a solid foundation from which students may grow and thrive in the realm of education. The role of TEDS is to assist individual students, local education agencies, state education agencies, and parents in navigating critical issues related to educational success and academic achievement. The ability to perform at the highest level in support of these groups depends on the TED's ability to obtain necessary resources from which to navigate challenges and barriers in order to adequately address these critical issues, including high absenteeism, low academic performance, lack of parental involvement, low graduation rates, and lack of choice in college and/or career paths. TEDs need to develop seamless, comprehensive programs designed to overcome these barriers to success, which address specific issues related to academic achievement. The Kiowa Tribe is in the process of aligning a variety of educational programs and services which will promote the effective, efficient administration through the Kiowa Education Agency. But the success of such a monumental redesign requires resources and support to embed sustainable elements into the TED that will give a solid and strong foundation to the agency to better serve its tribal citizens. Therefore, the Kiowa Tribe urges full support and increased fundings of the Section 2020 grants in order to provide adequate funding for tribes in need of expanding their capacity to improve their TEDs and their effectiveness. The success of Kiowa citizens in the realm of education is dependent upon the quality of health care they are provided to maintain wellness. It is with that in mind that I testify in support of increased funding for the Indian Health Services to adequately address the myriad of health issues faced by even our youngest citizens, as well as the hope of the Kiowa Tribe leadership to one day be able to contract for health care of its own citizens under the concept of self-governance. We know that resources are strained in regard to healthcare because of the intrusion of COVID-19 and subsequent variants that have critically impacted our Kiowa community. We have lost hundreds of citizens to this epidemic and are continuing to feel the residual impact of the disease as our people continue to struggle with recovery. We are uniquely impacted with the loss of our knowledge keepers and cultural treasures whom are irreplaceable and beyond value to our community. It is imperative that resources are made available to address ongoing health-related issues among our young citizens in order to undergird their wellness, which also enables them to be successful in the realm of education. We urge Congress to adequately fund the Indian Health Service in order to provide quality health care, wellness programs, and services for our youngest citizens to fulfill promises made generations ago. I want to extend my appreciation to the subcommittee for allowing me this opportunity to provide testimony in support of funding of programs that are so critically important to Indian country. I'm especially thankful to my Kiowa tribe for allowing me this opportunity to speak to these issues so critical to the well-being of our people. And I say aho in our language, which means thank you. Thank you.
Thank you. I appreciate all of your testimony. Doctor, thank you for your persistence and commitment to education, because just like every sector of our society, whatever your nationality, we all recognize that advancement is made through education. So thank you for your persistence. Linda, you gave a lot of specific testimony on various things. A lot of times recommendations that are made, we look at and go, that makes sense. Why don't we do that? And you call the agency, and the agency kind of goes, well, we can't do that because, or sometimes they say, yeah, we can do that. I'm going to have to read your testimony because it's very specific on recommendations and stuff that we could make, so I appreciate that. But it will take me some time to digest it if it's okay with you. And Ryan, in a few minutes, I'm going to turn over the time to Mr. Kilmer, and he's going to explain why he's never invited me to the Olympic Peninsula to visit. I'm going to get there over the next, this year or next year. We're going to get up there and see that. But a couple of you mentioned grant programs. We have heard from some people testifying that grant programs aren't good because all of a sudden it's competing one tribe against another tribe. And if we're trying to meet obligations that we have, should we have tribes competing against one another through grant programs, or should they be through formula sort of things that send it out to all tribes? And I'd like your feeling on that. I don't know, any of you.
Absolutely. So that's what we advocate for two reasons. One, if they are allocated through compacts and contracts, then the tribes have the flexibility to apply the needs that they have in their respective communities. And as you know, we are all very different. We're all tackling very different issues. And so it gives the flexibility to be able to handle what is most concerning for that tribal community. The second thing is that I think grants have become a mechanism by which the agencies know that they don't have to pay contract support, and contract support is the backbone. So you need the support, you need your overhead, you need your systems like admin, HR, procurement in place in order to support the direct services that are being provided. So I think there's...
Okay.
And in terms of grant competition, for us, the Kiowa tribe is very small. We are home to 39 tribal nations and headquarters, and so we are often competing. And as a small tribe in southwestern Oklahoma, our population fluctuates between 10 and 12,000. We can't compete with some of the larger tribes who have grant writers in place and they have staff, resources that we just don't have. And so it's often that kind of scenario for us.
And of course, you realize that a lot of times we put grants in place because we think that competition is better, that it improves the situation. But it's I look at it just a little differently if you're trying to meet obligations that you have to meet, So that's something we need to have a discussion about, how we do some of this stuff in the future. But thank you all for your testimony. Ms. Pingree?
Yeah, thank you very much. And I concur with the chair. I thought you made some great, really specific recommendations, some of which we've heard before on reconciliation and other things, but I want to look through them and see how It seems frustrating for you guys that I know you come before us year after year and often say the same things. And some of these problems we just have to resolve at the IHS, and it just can't go on forever. And thank you for your testimony, your commitment to education. And I'm particularly interested in the relocation issue. It's been something I feel, and I know we're going to hear more from Mr. Kilmer about it, and he's talked to us a lot about it and talked about really with great pride that this is one of the communities that has been moving forward on it. But I feel, for a long time we've been underfunding this, haven't been acknowledging the great need that is out there and coming at us very fast. And you're a perfect example of a community that's already moving forward and realizing what has to get done. Just a couple of questions, because I wanted to, and I haven't had a chance to read your whole testimony, but how many members are there in your communities? I know you have 2 you're relocating, and in terms of like the master plan for the second part, where specifically do you go for funding on that? Is that part of the climate resilience money as well?
Yes. The funding from the Climate Resilience Act would be able to help us fund both village relocations. And even though we've developed a master plan for our main village of Tahola, where our tribal headquarters is, we've done fairly well starting that. There's really no blueprint for relocating an entire village, so we're doing our best to make it up as we go. And we have a pretty significant number of staff that have been super beneficial. But we're also relocating a second village that's considerably smaller. I would think that the cost of it would be a smaller fraction of the $400 million, but there's still a lot of unknowns. So we're looking for about $1 million to start the master plan for the relocation of the Queets. And then we also have some blueprint-ready projects to help moving the Queets village out of there, mainly government buildings, huge emergency assistance buildings that, in case of an earthquake did come, especially if it came at nighttime, there wouldn't be any villages left if the earthquake and the tsunamis were to come at nighttime. Actually, I brought a really amazing picture here, and this picture is taken of the Pacific Ocean and in our village. This was at the height of a king tide, mixed with about 6 days of 3 inches of rain each day. About 2 hours after that picture was taken on that residential street, there was about 2 feet of water. It took about 6 days for that water to recede back outside of our village. This was one of the biggest threats that the Pacific Ocean has came right into our main river and started consuming our village.
And how many members are there in your community?
Our community, and both communities, there's about 1,500 in our main village of Tahola, and then there's about 250 in our northern village of Queets.
Got it. Great. Well, thank you for what you're doing and for filling us in on where you are with it.
Thank you for your questions.
Thank you, Ms. Pingree. Mr. Kilmer.
Thanks, Mr. Chair. Thanks for being with us. I'm glad you showed that picture, because if you Google Quinault Indian Nation and flooding, there's so many photos of people literally like paddling a canoe through the streets of Tahola. I cannot tell you to my colleagues, I can't tell you how many times when we are facing a significant storm event, we get a call saying, "Hey, can you reach out to the Army Corps because our seawall is going to breach and our village is going to fill up." And so, and we're going to hear later from the Makah tribe, and they have similar challenges. There's 4 coastal tribes in the district I represent that are really facing existential threat from rising sea levels, not to mention, as you point out, the threat of tsunami, which is really scary. I was hoping that you could just talk a little bit about the barriers for moving forward with relocation, any other resources that you can mention to this committee in terms of what it's going to take to move your people to higher ground.
I think that securing the resources is definitely our biggest threat. We're so remote, and there's not a lot out there. As far as access to contractors, the way that the market is moving with contractors, my previous position was a construction manager for our tribe before I ran for the elected seat. So trying to secure contractors in today's market with the amount of inflation has been an uphill battle. It's not only looking for the funding, it's having enough funding to be able to secure the bigger contractors for the right amount of money and giving them an amazing amount of work to be able to sit in one location to where they're not running all over the countryside looking for the next dollar. So inside of we've currently funded our phase 1 of our infrastructure and the cost on that was $10 million. So, you know, a lot of these projects that we're moving forward and funding on our own, it wouldn't be happening if we didn't have the larger pots of money that we've been so fortunate to have access to.
Can you, has the nation priced out, you may have said this, but if you did, I missed it. Just for use Tohola as example, to get through all the phases of moving Tohola, I mean, it's moving a village, right? So you're literally like building out utilities, you're building road infrastructure, you're building government buildings, at some point more housing. So what's the price tag?
The total estimated price tag is about $400+ million to relocate everything from residential, government buildings, streets, water, sewer, power, post offices, gas station.
Yeah. So, I mean, I asked this in part because we're talking about $61 million for the tribal climate resilience for the entire country. You just gave the price tag for one tribe.
One tribe.
So we got challenges there. Thanks. I yield back.
Thank you, Mr. Kilmer. Thank you all for your testimony today. Dr. Satok, I'm originally from the Panhandle of Texas, from Perryton, 7 miles from Oklahoma, which historically has Kiowa heritage. And the place I grew up, we continue to find evidence of villages in where we grew up on Wolf Creek. So Aho, thank you for coming today. I was curious, in addition to everything else that's going on, how many native speakers still exist in the Kiowa tongue?
That's a good question. And we lost a lot in the pandemic. I can tell you personally, I was working with an ANA grant for language, I don't like to say revitalization, but reclamation. And personally, 2 of my elder mentors passed away during the time of COVID. So we are under 50 for sure. We know that we have some speakers who are not as mobile, they're not as visible in the community, but we do still have speakers. We're fortunate in that we have a wealth of information through our songs. A lot of our language has survived through our songs, but we do still have speakers, but it's a very small aging population.
How do we keep the next generation of native speakers going?
I feel like we need emergent programs where people can treat language like a job, because I have taught Kiowa language at the beginning level at the University of Oklahoma for 10 years, and 3 classes or 5 classes a day for 50 minutes is just not enough to retain the language, and we're not immersed in the language like we used to be. We're more dispersed and spread out, so we have Kiowa people living all over the globe, and it's very hard to have that day-to-day conversation and interaction. So we need more funding for those kind of programs and a focus, I feel like, on adult learners. I know a lot of attention is given to young speakers, early childhood, but our adult learners are the ones with the motivation and the need. They're the ones that are motivated, and so the ones that are in language, they're dedicated for years and years, and it's really a lifetime commitment that they make. So I would say emerging programs and also adult language programs as well.
Okay. Well, thank you very much for your testimony. I have a kindred relationship with the Kiowa Nation. My grandfather in 1910 was in a picture with Chief Spotted Bird.
Wow.
And had a good relationship with them. So thank you very much for your testimony. And Ms. Austin, I come from Texas. There's only 2 tribes in Texas, and your testimony today has been very valuable for me, and especially when you say that the agency's contract support cost reporting obligations should be met. We didn't put it in there as an option. It's a requirement. It's the law. So I look forward to having the staff here and working with the chairman and ranking member and my staff to make sure they meet those obligations that we didn't ask them to. It's it's the law. So I look forward to working with them. There are three tabs. Okay, thank you very much. Okay, I think that concludes our testimony for this group. Thank you all very much. And next up are Joette Walters from Tuba City Regional Healthcare, Ned Norris from the Tohono O'odham Nation, and Robert Miguel from the Ak-Chin Indian Community Council. Welcome to the 1020 testimony. We are grateful to have the three of you here today, and we'll start off with Joette Walters, the CEO of Tuba City Regional Healthcare Corporation. Welcome.
Good morning. Good morning. I'm Joette Walters, the CEO of Tuba City Regional Healthcare Corporation. Thank you, Chairman, Ranking Member, and Subcommittee for allowing us to testify this morning. I'm coming to you to discuss our cancer care program at Tuba City Regional. We are a self-governed tribal organization on the Navajo Reservation and the only provider of cancer treatment in the lower 48 states on a native reservation. 4 years ago, we built our specialty care center without any federal construction funds, but that was not for lack of trying. Both the IHS, the Indian Health Service, and the National Cancer Institute repeatedly told us that they don't do cancer treatment on Indian reservations, and so forth. We did it ourselves. When the National Cancer Act of 1971 was passed, tribes were forgotten. We've been to Capitol Hill before to share our story, but yours is the first committee to invite testimony and about why dedicated federal funding is needed for cancer treatment programs on Indian reservations. So I'm honored, but I'm also pained to have to be the one to tell you that not one federal dollar has been dedicated for cancer treatment on Indian reservations. 10 years ago, we committed to take this issue on. Our first challenge was to build and equip a cancer treatment center without any dedicated federal funding. We used our third-party resources and donations from corporations, philanthropists, and individuals. Our own employees took up collections, and we even launched a GoFundMe campaign off a billboard on Interstate I-40. Our second challenge is sustainability. Now that we have the Cancer Center open, the CMS, Centers for Medicare and Medicaid Services, refuses to pay us the same reimbursement for chemotherapy drugs that they pay non-tribal providers. About 50% of our claims are rejected by CMS, and CMS only allows us to bill Medicare the all-inclusive OMB rate for outpatient visits to tribal healthcare facilities, which last year was only $541. The OMB all-inclusive rate captures the average cost all IHS and tribal healthcare providers incur for services. It is unreasonable to expect it to reimburse the cost of life-saving chemotherapy drugs and oral medications. The OMB all-inclusive rate does not contemplate the cost of oncology because the IHS does not provide oncology care. The $541 OMB all-inclusive rate for chemotherapy drugs does not even cover the cost for the drugs. Chemotherapeutics are expensive, and CMS refusal to repay or fairly reimburse us for the raw cost of these medicines threatens our sustainability of our operations. Our specialty care center has already provided chemotherapy infusions and treatment to 800 cancer patients in the last 4 years since we've opened. And we're also bursting at the seams. Before we opened our cancer center, we reached out to CMS to let them know our intention to provide cancer treatment. We thought reimbursement would not be an issue because their own policy sets out how Medicare reimburses IHS and tribally operated providers for drugs that doctors administer to patients in outpatient settings. In fact, Chapter 19 of the Medicare Claims Processing Manual covers the IHS. This IHS section and says drugs provided by a physician in the office setting are paid using the average sales price from the Medicare Part B drug pricing file supplied to all Medicare administrative contractors. So how could we have known that CMS would refuse to follow its own policy that would otherwise fairly reimburse us? If our 2 oncologists were administering infusions and oral therapies to patients in a non-tribal facility, then CMS would reimburse them the average sales price of the drugs, but that's not happening in Tuba City. When we met CMS Director Sis Shamani earlier this year, we brought this problem to her attention. Though she and her staff expressed their commitment to work on it, we have not heard anything yet. We cannot afford to continue to lose money every time we treat cancer. As this committee considers what is needed to fund health care for American Indians, we respectfully urge you to include language that directs CMS to reimburse chemotherapeutic drugs administered by a tribal health care provider the same way it reimburses other non-tribal health care providers. CMS's failure to do this is a regressive healthcare practice that discriminates against American Indians. We also encourage you to consider how to fund the establishment and expansion of cancer treatment on Indian reservations. Tuba City Regional is proud to be the first cancer treatment facility on Indian country in the lower 48 states. I invite this committee to come visit us and to see for yourselves that dedicated federal funding is urgently needed so that we are not the last cancer treatment center on Indian countries. Consider our specialty care center as being a cornerstone upon which our nation's first tribal center of excellence for cancer treatment could be built. Tomorrow I'll be at the White House to participate in the Cancer Moonshot Forum. This is historic because it's the first time any tribal representative has been included in the creation of our nation's cancer policy. The administration's commitment to reauthorizing the National Cancer Act provides the opportunity to finally include us First Nations and Native American peoples in the national cancer treatment system. So Tuba City welcomes this historic moment and asks that the federal government not dismiss us. Thank you.
Thank you, Ms. Walters. Chairman Norris.
Thank you. Good morning, Skuk Serdik, Skuk Dash. Good morning, good day. Chairman Simpson, Ranking Member Pingree, and the distinguished members of the subcommittee. I am Ned Norris, Jr., Chairman of the Tohono Nation. The nation appreciates the opportunity to testify today and appreciates your focus on providing critically needed financial resources to Indian country. First, I ask that you prioritize funding for our roads. BIA Roads Maintenance Program is badly backlogged. During monsoon season, our reservation roads are washed out, preventing access for emergency vehicles, isolating communities, and stranding our members, including children on school buses. Tribal members have been killed by flooding while traveling on these roads. In addition, many of our roads are used and damaged by Customs and Border Protection. We are grateful that since FY18, appropriations legislation has authorized CBP to transfer funding to the Bureau of Indian Affairs for road repair work, and that the bipartisan infrastructure law included a permanent authorization for CBP to transfer funds so that we do not have to ask for that authorization language every year. Yet funding remains woefully inadequate to address the damage done by CBP. FY24 appropriations must include significantly more funding for BIA road maintenance, and that it also make clear to BIA that it has permission, it has permanent authorization to accept CBP funding based on the bipartisan infrastructure law authorization. Next, I want to underscore our need for water settlement funding. The nation was one of the first tribes to enter into a congressionally approved water rights settlement, but chronic underfunding means our settlement has never been fully implemented. Interior's efforts to address some of this underfunding through the Indian Water Rights Settlement Completion Fund has been helpful, but discretionary funding must be made available to complete implementation of our settlements. Otherwise, the nation will never receive the compensation promised to it. Lack of federal funding for law enforcement creates significant challenges where tribal law enforcement is the first and only responder to criminal activity. The nation's police department is housed in a converted 1950s-era BIA jail and is entirely inadequate to meet the public safety needs of our 34,000 citizens. The nation must house detainees in facilities out of state. The nation also faces major law enforcement and public safety challenges relating to a 62 miles shared border with Mexico. The Tohono Police Department must cover a huge geographic region, including remote and isolated areas along the border. The nation has a positive, long-standing working relationship with CBP, but federal financial support for tribal border security-related law enforcement is extremely limited. The nation spends more than $3 million of its own money annually to help meet the United States border security responsibilities. We also desperately need continued federal investments in Indian Health Service facilities. The nation's 50-year-old hospital in Sells, Arizona is one of the oldest IHS hospitals. Due to its age and lack of modern equipment, the Sells Hospital can only address minor medical issues and is unable to serve the broad range of healthcare needs of the nation's citizens. The Sells Replacement Hospital has been on the IHS facilities construction priority list for nearly 30 years. Although we finally have received some preliminary planning funding, the nation still needs the funding necessary for actual construction. Finally, better funding for BIE facility construction is critical. In its latest facilities report, BIA lists 3 of the 5 of our BIE-funded schools as being in poor condition. The nation's Santa Rosa Ranch School was forced to close in 2018 due to significant safety issues. While BIE reopened the school in 2019 with temporary modular units, no permanent construction has replaced them. Poor conditions at BIE schools put Native students at a significant unfair educational disadvantage. The nation urges Congress to provide critical funding for BIE facility construction. Thank you for your time today. Your work here can have a positive impact in Indian country and can change lives. I'm happy to answer any questions. Thank you, sir.
Thank you, Chairman Norris. Chairman Miguel, do you still have 7 kids at home?
They're not all at home, but I have 7 kids.
Okay. Well, so enjoy your time off.
Thank you, sir.
Thank you for being here. Please
Okay.
proceed.
Skooksiadik, good morning, Mr. Elsie and Mr. Kilburn and members of the subcommittee. My name is Robert McGill, and I'm honored to serve as chairman of the Auction Indian community. I'm excited to be back in front of you for the first time in a few years to discuss the community's priorities. These priorities include funding for law enforcement and detention operations, 105 lease, and the need for the Bureau of Indian Affairs to receive advance appropriations. Auction is often for the mouth of the wash. It's the word mouth of the wash, the place where it recedes into the ground. It refers to a type of farming that relies on washes created by winter snows and summer rains, a type of farming traditionally practiced by our people. Throughout our history, we have relied on subsistence and eventually commercial farming for subsistence. Today, we own and operate the auction farms. We cultivate more than 15,000 acres of farmland, and the farms has been a central economic enterprise for the community since 1960. We also have economic entities focused on entertainment, gaming, and hospitality that have grown into major sources of economic development for the entire state, far beyond the boundaries of our reservation. The community is located about 40 miles southwest of Phoenix, Arizona. We are direct neighbors with the city of Maricopa, which is one of the fastest growing cities in the nation. We are a growing tribe of over 1,000 enrolled community members. We are committed to being good neighbors to nearby cities and towns while also working to build a strong future for the next generation of auction community members. Our community's law enforcement, court, and detention programs are all in need of additional funding. And our law enforcement programs are essential to the lives and livelihoods of community members, necessitates the prioritizations of adequate staffing for our police department and access to updated technology for police, detention, and courts, as well as equipment for our officers to provide police services for our community. With traffic, visitors, and populations increasing, and with inflation affecting all aspects of our operations, just as it has the federal government, we respectfully request an increase in public safety justice funding in FY 2024. In 2023, the Auction Indian community entered into a compact with the BIA to be a self-governance tribe. This compact helps maintain and improve the federal government's trust relationship and responsibility to the community by enabling tribal self-governance for various programs, services, functions, and activities, such as our law enforcement, detention, social services, courts, road maintenance, and other vital programs. The Indian Self-Determination Education and Assistance Act 105 lease program allows the reimbursement of facility costs when part of a facility is used to carry out ISDEAA-approved PSFAs. This program creates greater coordination and improves the efficiency of our tribal government, all while cutting through bureaucratic red tape within the federal government. In 2013, the community prioritized efforts to design and build a multi-purpose justice center, utilizing grants and tribal funds. The Justice Center houses law enforcement, detention, prosecutor's office, and public defender's office in our tribal court. As you could imagine, the maintenance and improvement, standard upkeep of this facility, along with all other community facilities carrying out other self-governance PSFAs, has been costly to the community. The community requests an increase of funding to the 105 lease program. Lastly, I urge your support to advance appropriations for the BIA. Currently, critical federal funding programs at the Department of Education, Department of Housing and Urban Development, Department of Labor, and Veterans Affairs are all authorized for advance appropriations. Advance appropriations are a necessity for tribes to ensure that funds are available in order to maintain critical tribal government functions during a federal government shutdown. For example, the community's efforts to become an IHS self-governance tribe under Title V was impacted by 2018-2019 government shutdown. Our payments were not distributed on time, and our delivery of health care related suffered. So, funding's uncertainty causes tribes to redistribute funds from other tribal programs just to get by, and this results in diminished services. Advanced appropriations will prevent future lapses in funding associated with government shutdowns and will help keep in critical services uninterrupted. We respectfully request advanced appropriations to ensure that tribes are not forced to shift around funds during a government shutdown. Again, thank you, Mr. Elzy, Mr. Kilmer, and members of the subcommittee for allowing us to, the auction community, to discuss the community's priorities and insight on how funding increases that will help the auction Indian community and surrounding areas dramatically. We hope this subcommittee will continue to build on previous funding authorizations that address severe underfunding historically of the programs mentioned. If in closing, if I may, Mr. Elzy, I would like to recognize my youngest child, Stella McGill, and members of the entire student body and staff at A+ Charter School in Maricopa, Arizona, who are watching online. Thank you.
Well done, Mr. Chairman. Thank you. Mr. Chairman.
Go ahead first.
Okay. Mr. Kilmer.
I just wanted to actually thank the two chairmen. I had the opportunity to visit both of your tribes several years ago and really enjoyed the opportunity to just see up close and personal some of the challenges and opportunities you face. So thank you for that. Hope to come back sometime soon.
Thank you all very much for your time. Up next is Nate Tyler from the Maca tribe, Terry Rambler for the San Carlos Apache tribe, Martha Garcia from the Rama Navajo School Board, and Michael Chavaria from Santa Clara Pueblo.
Right, before I start, I'd like to thank you guys for everything you've done in the last couple of years, you know, to get us through the pandemic. It wasn't perfect, but it helped out quite a bit. You know, from the Maca tribe, we shut down, totally shut down our reservation for two full years, you know, to try and save lives. So we do appreciate everything you guys done.
And it was, you know, trying to make sure that the tribes were covered in some of this pandemic
Mhm.
relief.
Wasn't perfect.
At first, it was not, we kind of missed that.
Right.
And then we went
You
back
did.
in and said,
Yep.
no, this has got to cover tribes too.
Yeah.
So,
Yep.
appreciate
So
it.
I do appreciate that. Chairman Simpson, Ranking Member Pingree, Congressman Derek Kilmer, truly do appreciate it, being here. Nate Tyler, Makah Tribe, Washington State, very most northwestern tip in the Washington State, 3,000 members, one treaty, one tribe. We're a fishing tribe. We depend on the ocean, we depend on the natural resources, always have, always will. Some of the issues that I'm going to bring up, it's going to be quite a few different issues. Overarching multi-departmental priorities, coastal resiliency. It was brought up, Quinault brought it up, Makah's going to bring it up, Makah Tribe. We're already seeing the impacts. Ocean acidification, algae blooms, warm waters, you name it, we're seeing the impacts. And it's having an impact on our fishing. The king tides, we see the king tides every year, corroding our shorelines. So we've been addressing that. So we do appreciate the programs that are in place. And we're actually in the process of doing some moving. We've been spending our own money. We spent well over $12 million, $15 million. We're spending another $10 million this year and moving some more projects forward up in the hills. So we moved our Head Start up above the tsunami zone. We moved some housing up above the tsunami zone. We moved some apartments up above the tsunami zone. We're looking at moving the clinic up there also. We did the wellness center about 5 years ago. So we've already spent a lot of our own money. And the clinic's next. That's a $20 million project. We will break ground next year. The Head Start building's almost complete. We're going to actually open it up in a couple months. So water shortages, that's always a big issue for the Makah Tribe. It's been a big issue. We've been coming here for 30 years dealing with our water issues. At one point, the federal government did have to come in India Bay and set up pumping water from the ocean to the village one summer because we see droughts year after year. So that IHS program, the sanitation deficiency program, I think it needs to be tweaked. We do have a number of projects in the water projects with IHS and EPA, but there's ineligible costs. There's tiers, Tier 1, Tier 2, Tier 3. We have a number of projects in each one. Tier 3 is never probably going to be funded. We do appreciate the funding that did come down this last year. That's going to address almost all Tier 1 projects in the next 5 years or whatever, however it's, 5 to 10 year project or 5 to 10 year funding cycles. Tier 2 is eventually going to get funded, but Tier 3 is never going to be funded. But Tier 3 is actually the project that is going to save the government money. It's the permanent water source, and if that was funded, we'll never have a water issue again, ever. And a lack of water stops us from economic development, future housing, future relocation, unless we have systems in place already, which we do, and that's kind of where we're at right now. Self-government models, compact negotiations. We want to get away from block grants. We want to get away from state pass-through funding. We want the money going directly to tribes. We spend the money. We have all the staff in place, accounting, audits, you name it. We pass year after year after year, and no better person than us to know how we should be spending our money. There's so much red tape, bureaucracy, reporting, and competing with other tribes. And some of these grant programs, it's just not enough money to go after grants. So direct funding is humongous. TIPO funding, I came here and went after the Great Americans Act, got $6 billion. And some of that should benefit the tribes. TIPCO is one of them. Indian Health Service, advanced appropriations. We've been dealing with this for decades. Advanced appropriations, mandatory funding, it's just got to happen. Once again, it's going to save a lot of money if you fully fund it. It's all about health equity. Workforce retention, training, that's another thing we need to address. Mental health, behavioral health, that's a humongous thing. Fully fund it and direct the funding directly to the tribes, not through grants, not through state, pass through states. IT modernization, that's another thing. It was funded. IHS kept the money. I think that money was intended for tribes, and the money should have went to tribes. So, we need help in modernizing our IT for our clinics so we can communicate across the board with other hospitals. We don't have hospitals for tribes in the Portland area. Our services are 2 to 5 hours out, so we do a lot of life flights, and it's the more money. If we fully fund it, we're going to be healthier, and if we're healthier, the less we're going to spend in saving lives. Community Health Aid Program, DHAT, the CHAT program, that's got to be fully funded. That benefits us as tribes. Makah has 2 students in the DHAT program that just opened in the Skagit Valley College. So those are the issues that, Makah faces. So I, appreciate the opportunity to be here to testify in front of you guys. And also I'd like to invite you out to Makah, go out on the boat, go fishing, come out with Mr. Kilmer. He comes out every year. Makah Days. Spends time with our people, so yourself and Ms. Pingree, I'd like to, have you guys come out and see it firsthand. I think that's important.
Appreciate
how
that.
we
Thanks
operate.
for the invitation. I know that Mr. Kilmer is just looking for free fishing is what he, no, I understand fully though, but I appreciate the invitation. Martha?
Thank you, Honorable Chair, Mr. Simpson, Ranking Member, and the Subcommittee Member, Mr. Kilmore. It's good to see all of you again here. My name is Martha Garcia. I'm the President of the Raymond Navajo School Board. I'm here on behalf of the Raymond Navajo people. We're very grateful that you have allowed us to come again this year. We have not been able to make it in the past 2 years, but we're here to let you know that we still have some pressing needs out there. We have priorities that we would like to present to you today. We were established as the Raymond Navajo School Board by the Raymond Navajo community. They took it upon themselves to establish the school board in 1970, and we're still operating today. We have Head Start, elementary, junior high, and high school, and then we do adult education. And on top of that, we also have contracted for the Pine Hill Health Clinic, the service from IHS, and then we have behavioral programs, and then other 638 contracts that we operate today. I'm here to present, first of all, the request for increased funding for the educational service. We have the ISEP funding that has been coming to us, but we're beginning to struggle the past 2 years. The state of New Mexico has been very generous with their public school. They have increased their funding, and that has created a situation for us where our teachers are seeing greener pastures on the other side and beginning to leave our schools. And we want to keep them because we have had them for a number of years, and they provide quality services. And so with that, we have to look at the ISEP funding to see what we can do to keep up with the competition that we're seeing, because we can't compete at this time. And this would be to increase the salary, the benefits. And also we're requesting for our staff to participate in the federal employee retirement system. That would really help us greatly. The other portion is the student transportation. We are out in a remote area, and we need additional fundings. All of our Navajo Nation grant schools are faced with this issue, and we have exhausted our funds every year by February. And we have to use ISEP fundings or whatever funding that's available to continue to provide transportation for our students, because they live at home and we have to bus them in every day. The other one is the forward funding that we're requesting for the facilities operation and maintenance. The O&M money has been coming in, but it's just taking care of only 50% of our needs to operate and maintain our buildings. And what we're seeing is that when the funds do not come in a timely manner, then if there's a government shutdown or if there's a continuing resolution that runs quite a while, then we don't get the funds until towards the end of the school year. And this creates a delay also in our tribal grant contract support funding, because there's a percentage that has to be included on all the funds that we receive in order to get that fund. So we would like to see this as a forward funding in the future, and if Congress can help us with that, that would really help with our needs to keep up with the maintenance and operation of our school. The other one is the increased funding for Indian Health Services. Right now, we're the only primary care services in 4 counties around us. We're in a very remote area in west central portion of New Mexico. So we provide outpatient services, and we provide emergency medical service, and we service both Native and non-Native who has insurance to pay for their care. And what we are seeing right now is that we need to have increase in order to continue to provide these services. And we also have the behavioral health programs, and we have the dental programs, and we could do so much more if we had increase in these areas so we can hire more staff. We just have 1 dentist right now and very limited emergency personnel. The other one that we are requesting increase for would be in the area of funds for new energy efficient buildings. We are operating out of buildings that are established or have been pulled in 1970s. These are portable BIA buildings, and we're still using them. And for our administrative service, our finance, social services, the adult education program, scholarship program, and other programs that have to operate out of these buildings, and they're falling apart on us. And what we're finding is there's no funds for replacement of these buildings. Yes, there's funds available made for school buildings, but not for the administrative buildings and the rest of the ones that I've named. So we're having a hard time struggling to maintain those buildings, and you wouldn't believe we have to cover our roofs with tarp in order not to have leaking roofs. So we would like Congress to consider this and see what can be done, and to do appropriate fundings for this. And then the other area that I have here, let me see, where am I, is the fact that we have a need for our community service program. Like I said, we contract a lot of the programs. We have the human services program. We have the social services, community and economic development, the aid to tribal government. And these, we need additional funds, plus the BIE budget. We have received Johnson O'Malley funds, and then scholarship and adult education. And because of these annual funds, which is appropriated by Congress, we are beginning to see that our funds have remained static and largely unchanged since the days of federal sequestration several administrations ago. And our staff salary and programs are unable to increase, and that's what we're seeing. I'd like to say thank you. We receive appropriation for our new school, 2 new buildings that will be established, constructed, and then renovation for the rest of the project. So we know you guys do make a difference in our community, and I thank you.
Well, thank you. Thank you for your testimony. Michael?
First of all, umbi akindi unsingi tamu. Never na ochitsang hedi on nanding wa umbi akin we pk umbi akin we han we no umbi akin hana kodi never how he angshoroma imara bane hori sotu pabe mani hingho. So my table of language, Chairman, I said good morning out of respect, and Chairman, may I have permission to speak? Yes. Well, thank you, Chairman. Good morning, Chairman Simpson, Ranking Member Pingree, and our subcommittee members and your staff for the opportunity to share our funding priorities for FY24, and thank you for your opportunity to testify before you this morning. My name is Michael Chavarria. I serve as governor in Santa Clara Pueblo, northern New Mexico, to include as serving as the chairman for the 8 Northern Indian Pueblos Council, which are the 8 northern pueblos north of Santa Fe. So I invite you all out to come visit us in New Mexico. It's Christmas year-round. In my testimony, I have set forth a number of specific recommendations that I submitted for the record. In my oral testimony, I will offer up some broad themes. First of all, I'd like to thank the committee for your support for many of the Indian country programs and opportunities with your assistance. I would like to remind the committee that the inflation rates eats into the value of the appropriations. And so it is further inroads are made into Indian funding shortfalls, so there must be increased substantially greater than the inflation rate. So that's very important and critical. So the last few years, Congress has made major actions to protect traditional cultural values, sites of importance, such as imposing a moratorium on the development of the Chaco Canyon, to also include the passing of the STOP Act, which prohibits the exports of many sensitive tribal cultural items. So we urge Congress to continue that moratorium, but also provide robust funding to implement the STOP Act and to boost funding for our Tribal Historic Preservation Officers, or TIPO, which is very important because they are the front line that most tribes depend on to defend and protect those cultural resources. I also urge the continued strong funding for BIA law enforcement activities in this area. You know, unfortunately, Santa Clara Pueblo has been subject to 5 presidential disaster declarations in the last 15 years, resulting in catastrophic fire, but also flooding. As we have worked to recover, we have discovered that meeting the federal cost match requirement is very difficult. It poses a financial hardship and a barrier, especially we have multiple grants that come with a cost match. So we do not have surplus funds. So we urge the committee to direct the agencies to freely grant tribes with waiver of those cost match requirements and working together for these opportunities for our people. You know, Santa Clara Pueblo has entered into self-governance funding agreements to assume administrative functions on the adjacent national park lands, including the Bayas Caldera and the Bandelier National Monument. We have also entered into Title I 638 contracts, self-determined contracts with the Forest Service under the Tribal Forest Protection Act. The Pueblo has implemented a holistic approach to land level management and utilizes the benefit of nature-based solutions and engineering with nature to support the ecological functions. These agreements allow us to play an important stewardship role with regard to our traditional cultural sites of importance across the landscape, not just on our lands. So we urge this committee to encourage the agencies to enter into more of these agreements with appropriate funding to include contract support costs. And we appreciate back in 2009 when Congress passed legislation authorizing the planning and implementation of improvements to our irrigation infrastructure for the 19 pueblos in New Mexico. Improving these systems will save critically needed water resources and boost our agricultural activities. So please support funding for these identified projects. And as mentioned, law enforcement and emergency services personnel strive to protect the life, safety, and welfare of our entire community, even our guests through tourism, native, non-native. They respond to these unfortunate situations. We're not immune. Drugs, alcohol, domestic violence, child abuse, Chairman, it's all there. Right now we're seeing high cases of fentanyl, heroin within our lands. And BIA does not have enough resources. Yes, we are a self-governance tribe. However, those funds are based on a tribal share. The pot hasn't grown. And unfortunately, even the state hasn't protected us. So it's very important that we utilize these appropriations because we're seriously understaffed, but also underfunded. Meanwhile, our tribal courts need additional resources to function efficiently. Further, we need cultural responsive detention services to improve recidivism rates and the long-term rehabilitation. Incarceration is not the answer. You know, one of the things that I heard, we have a jail in northern New Mexico, Rio Arriba County. One person said, "Governor, send me to jail. I get better drugs in jail." I'm like, "What, are you serious?" So they get getting in trouble because, again, that system is broken. But they're fed breakfast, lunch, dinner. They have a roof over their head. But unfortunately, that still happens. And that was sad. I was hurt by that. You know, so we need a place to send them for long term that's culturally relevant, that teaches who we are, the priorities, so they understand, because eventually they got to transition back into the community. We don't have any transitional homes or housing for them. Again, how do you educate them? And so culturally relevant rehabilitation centers are very important. And this leads to education. You know, leave the education in our hands. They are our children. Not only to succeed in modern society, but also to be rooted in our history and our culture. And for us, it's our table language. We still speak our language. We still sing our songs. We still do our dances. But we know our children can do better. But that's all of our job, to come together to do a good job. So we urge the increase in funding, as mentioned, for the BIE, Tribal Education Department, the Sovereignty and Education Grants, as well as for the ISEP. These funds provide a core budget account for BIE-funded schools, covering teacher salaries, aides, principals, and other personnel. As was mentioned, last year, the state of New Mexico passed the Teacher Parity Act. At level 1, they're paying them $50,000. And that's taken away from us. We can't compete. We don't have no competitive salary to hire additional folks because they're going to the Espanola public schools. And so that's taken away from us. So, Chairman, we just ask for your assistance. And lastly, I don't want to forget about the EPA. EPA resources enable our Pueblo to establish and maintain technical ability to support a wide array of projects that protect the human health and the environment. So I strongly urge the support for EPA and then general assistance programs. So, Chairman, members of the committee, I appreciate your time. I now stand for any questions.
Thank you, Michael. Appreciate it. Interesting comment. Let us be in charge of their education. The children belong to us. That's a cry you're hearing all across the country right now from all sectors. Mr. Kilmer.
Thanks, Chairman. And I do want to formally invite you to the Olympic Peninsula and visit some of it. So Macaw Days is August 26th and 27th, and the war canoe races, the traditional dancing, the salmon bake, you just breathe better when you're out there too. All right, yeah. I'm not doing the dancing either. Thank you for coming. You probably, maybe with the exception of Alaska Tribes, win the long distance travel award for making it here. You spoke about the water shortage and the flood risk. Can you just say a bit about how that affects daily life for members of the Macaw tribe? And can you, again, say what program we got to fund so that we can fix the water shortage problem?
All right. Appreciate that question, Congressman Kilmer. How does it affect day-to-day life? Almost every year, we go into some sort of restriction dealing with our water. We have one reservoir. It's kind of odd because, you know, we do get a lot of rain, up to 100 inches a year. But the rain, we're on shale. You know, we're surrounded by the Pacific Ocean, Straits of Juan de Fuca. It hits the shale, it disappears. So IHS water program, EPA, IHS, the sanitation's deficiency report lists all our projects.
Yeah.
And those projects are tiered, tier 1, tier 2, tier 3. Tier 1's actually going to be funded. You know, but tier 3 is, like I said, tier 3 is
fix the problem.
It's going to fix the problem, $16 million. So if it gets funded, it's going to be funded probably in 20 years, and it's going to be a $30 million project. You know, today it's 16 million. All them other projects that we have in Tier 1 and Tier 2, if you add up all our projects, it's probably close to 16 million. So we're going to spend 16 million on Tier 1 and 2, and then eventually 32 million on Tier 3 at some point. So if we just funded Tier 3 today and did the permanent fix, we're spending about 18 million.
Chairman, if I can ask one more quick question. You talked about some of the relocation effort that the MCAW have already undertaken, and including the health clinic, which was included in the omnibus. We got some funding for that. Has your tribe costed out of the other things that need to be relocated what the price tag would be to get to higher ground?
Right. So currently, we're actually looking at relocating our school. That's the elementary and the high school. That's going to be in excess of $20 million also right there. And you got to understand, anytime we do this, we give up resources because we're a natural resource tribe. So we're using our own resources to do a lot of these projects. Yeah. You know, we're tying up resources, we're going after funding, we're going after loans, we're using our own money. You know, and we can only do that for so long, you know. So we have the school, the high school. It's a public school. It's not a BIA school, but you know, we do believe the BIA and the state of Washington. So the feds and the state of Washington play a part in relocating our school also.
Yeah.
That's going to be, like I said, in excess of $20 million to do that. And it has to happen.
I just want to mention, Chairman, since you had to step out for a bit, when the Quinault was here, they said, you know, please fund the Tribal Coastal Relocation Program at $61 million. Their price tag just for their lower village at Tahola was $400 million, just for one tribe, one relocation, $20 million just for one school. So, you know, we got to plow some more resources into this. Otherwise, you're not relocating for 300 years.
Yeah.
Right. I yield back. Thanks.
Thank you.
Thank you for your testimony, and thank you for being here. I'm sorry I had to step out for a minute, but I really appreciate what I did get to hear. And I just want to reemphasize, I've been concerned about this relocation fund for quite a long time, and the Washington State tribes are where we're seeing some movement, but you know, there's already a tribe, at least one moving in Alaska, and we're not even discussing Alaska when we're talking about, you know, a couple of tribes in Washington State, and there are more there. So it's just a huge issue.
Thank you for your testimony. It's almost weird to think of having water problems in Seattle, where I understand it never stops raining. You know, are you talking freshwater issues, or are you talking? Okay.
No, we're talking fresh water.
Do you pump? Do you have an aquifer you pump from, or is it lakes and reservoirs?
One reservoir.
Okay.
So IHS has done wells throughout the reservation, trying to find water. One of the problems when we're pumping wells and putting it back into the system is we're taking away from river systems that have salmon.
Don't do that.
So that is one of the problems.
Yeah.
So we're, you know, I mean, and adding wells isn't really the answer.
Yeah.
You know, it's only going to give us so much. It does help out, but it only gives us so much. You know, and
pretty soon, if you find water down there, you overpump it, and then you're short on the aquifer below, which is happening all across the country.
right. And we've been looking, you know, for 25 years now. So
Anyway, I appreciate it. You mentioned transportation. I will tell you this story. We were on the Navajo Reservation in Arizona, and I had a Fitbit on. They took us out to a reservation grade school that was about 10 miles out on this road. I was just riding in the van. I got 30,000 steps riding in the van out to this school, which tells you what the road was like. I mean, it was just like this all the way out, you know? But it is, I understand they fixed that road now. I was wondering if they just kind of made it rough for us so that we, no, I'm just kidding. But you're right, transportation issues on reservations are a huge issue and stuff. So I appreciate all of your testimony. Thank you for being here. We will take it into consideration, obviously, as we write our budget and stuff. Thank you.
Thank you.
Okay, next we have Frank Dayish, Julius Murray, and Don Davis. Thank you. Appreciate it. Thank you.
Sorry about that, Chairman.
Okay. That's a true story. I think it was 30,500 steps just riding out there. Betty McCollum was saying the same thing.
Mr. Chair.
How are you doing?
Outstanding, thank you, sir.
You bet. Ah, that's where it grows.
In his state.
Yeah.
It used to grow in Corpus Christi, too. Not anymore? Not anymore.
Frank, you're up first. Push the, yeah.
Good morning. My name is Frank Dayish. I'm the chairman of the Council of Peyote Way of Life Coalition. I'm also the former vice president of Navajo Nation, so I appreciate your comments, and the roads are actually like that.
Yeah.
So. Also a former Marine and a former president for Native American Church in North America. On behalf of the council, I'm here to testify for and about my serious concerns to the distinguished committee here. Thank you very much. And it's regarding pharmaceutical companies, their interest to appropriate heritage molecules, in particular mescaline derived from peyote, and to request funding for federally recognized tribes to protect and conserve land where peyote grows in its natural habitat. Also to request funding to implement the American Indian Religious Freedom Act of 1994 amendments. As a coalition of stakeholders representing the interests of Navajo peyote practitioners and members, we are extremely alarmed and concerned of pharmaceutical companies' strong interest to appropriate mescaline derived from our sacred peyote medicine. Peyote is a sacred plant to the Navajo people, including many other federally recognized tribes throughout the country. Navajo people, including other American Indians, were historically persecuted and prosecuted for their religious use of peyote for more than a century. Many tribes fought numerous legal and political battles at the tribal, state, and federal levels to achieve their right to use peyote within their respective traditional ceremonies and cultural ways. The American Indian Religious Freedom Act of 1978 protects the rights of American Indians to exercise their traditional way of life by ensuring access to sites, use, possession of sacred objects, and the freedom to worship through ceremonies and traditional rites. Furthermore, Public Law 103-344, and this is why we're requesting that it be funded so that we could implement it. ARFA Amendment of 1994 provided that the use, possession, and transportation of peyote by Indian for bona fide traditional ceremonial purposes in connection with the practice of traditional Indian religion is lawful and shall not be prohibited by the United States or any state. Therefore, the use of peyote is federally protected and should only be used by federally recognized tribal member. I am deeply concerned by Journey Collab and other pharmaceutical companies who applied for patents to the Federal Drug Administration to synthesize mescaline. I understand Journey Collab claims to have engaged in consultation with Indian communities and individuals who use peyote. However, They have never consulted with the Council of Peyote Way of Life Coalition organization, the 5D Native American Church of Chechalta, Azeh Benahaga of the Ne Nation, the Ne Native American Church of New Mexico, and also including many Navajo Peyote organizations throughout the Navajo Nation. Most importantly, no consultation was completed with the Navajo Nation, where thousands of Peyote members reside. The Council of Peyote Way of Life Coalition strongly opposes any extraction and synthesis of mescaline from peyote and any cultivation, tincture, or manufacturing for scientific purposes, or for any other reasons outside of traditional bona fide ceremonial settings or purposes. In addition, we oppose the decriminalization of peyote and stress peyote should be used for religious, cultural, and ceremonial purposes by a federally recognized member only and protected under federal law. Tribal nations have a unique relation with the United States based on Indian treaties, U.S. congressional acts, U.S. Supreme Court decrees, executive orders, and memorandums which are considered the supreme land of the United States. Therefore, our focus is to leverage public awareness regarding the serious concern by making sure that tribal nations' unique government-to-government relationships is upheld with respect and honor. We strongly believe that we can achieve this in part by support from your distinguished committee. In closing, the Council appreciates the Committee on Appropriations, Subcommittee on Interior, Environment, and related agencies of the House of Representatives for allowing me to express our concerns regarding pharmaceutical companies' interest to appropriate our peyote way of life and to request funding to protect and conserve land where peyote is grown in its natural habitat. Also to request funding to implement the American Indian Religious Freedom Act amendments of 1994. Thank you for considering my testimony.
Thank you. I'm going to call on Don next.
Thank you. I was wondering if that map can be raised a little bit higher for you all to see, because there are some portions on the bottom that would be helpful. Thank you.
Yeah, it might just be better to move it over here so we can.
Oh, yeah, that would be good. Thank you.
Great. I see. Found a job you can do. Yeah. Okay, Don.
Okay, greetings, Chairman Simpson, Ranking Member Pingree, and the remaining of the other members of the committee. My name is Dondi Davis. I am a NUA and an enrolled member of the Shoshone-Bannock tribes where I reside in Fort Hall, Idaho. I am also a lifelong member of the Native American Church. I am testifying in front of you today as an independent researcher and as co-chair to the National Congress of the American Indians Peyote Task Force, and as a member of the Native American Church of North America's Legislative Committee, and to also support their request for peyote conservation projects and initiative. To share briefly about myself, I was raised with peyote and its teachings by my maternal NUA grandparents, Lillian and Levon Jackson. It's a generational practice that we maintain today. I have been a peyote researcher for over 18 years and have spent time in South Texas, interviewing and meeting with landowners, peyoteros, and many locals, while also interviewing Native American church members from across the nation. Many of these individuals I now call my friends. As a Native American church member, researcher, and scientist, I have an obligation to peyote and to the land for which it grows, and am deeply concerned for the future of peyote. My research and work, both nationally and internationally, has been written for a moment just like this. Peyote, also known as Luphophora williamsi, has been categorized by the International Union for the Conservation of Nature as a vulnerable species. Peyote's decline is impacted essentially by two threats, one to the population and the other to the habitat. Both can be directly correlated to humans. Through anthropogenic activities and agricultural modifications to the land, fossil fuel development, improper harvesting techniques by peyote distributors, poachers extirpating populations through rugged theft, psychedelic tourism, road development, exurban growth, and other land conversions. This also includes the lack of regulatory mechanisms, proper harvesting guidelines for peyote distributors, lack of education of peyote's wild population, and other recent threats in the form of extreme weather events, invasive species like feral hogs, wind energy, and decriminalization. But the greatest threat at a landscape scale is fragmentation due to destructive land treatments and conversion across its range. Emerging threats and the deep complexity creates an urgent need for population and landscape level conservation that is inclusive of a multitude of stakeholders, including federally recognized tribal members belonging to Native American church chapters, tribes, and Texas landowners. Through spatial analysis, substantial habitat loss is occurring through conversion of the Tamaulipan brushlands of South Texas into pasture, particularly for the non-native buffalo grass, a preferred forage crop. Approximately 95% of Texas is privately owned, meaning it is highly likely that the peyote habitat in the United States falls 100% under private ownership within the state of Texas. I would like to submit a map that I developed as additional support to my testimony, which you can also see on the poster there. This map and others presented today will help explain approximately how much peyote habitat exists in the United States. So in the map that you see over there, the top map reflects the potential habitat I delineated in my PhD dissertation using peyote occurrences to identify potential habitat based upon dominant soil and vegetation type. This is the potential habitat across peyote's range extending from the United States into Mexico. The map below that of Texas depicts the northernmost extent of the range within the United States in orange. This is the area of focus and makes up approximately 22,350,400 acres. It is likely that areas that have the potential to support peyote within this area have been extirpated. The two images at the bottom depicts an example of landscape level changes in vegetation that have occurred in 2006 and 2022. This is within the commercial zone of peyote. This is just one example of the profound changes that can occur over time. It is probably safe to assume that peyote has also been extirpated in this area as well. In just over a decade, aerial imagery clearly shows that the peyote commercial zone is quickly being converted to non-native vegetation types and for green energy development. Although the range of peyote is quite extensive in Texas, the analysis conducted shows that peyote does not occur evenly or homogeneously throughout the range. Therefore, conservation planning should include the larger extent that you see on that middle map. At one time in our history of peyote pilgrimaging in South Texas, Native American church members had the ability to harvest their own medicine through relationships they had with Texas landowners. My grandfather shared this experience doing just that. I have been lucky to do that as well. But that is not the same for every Native American church member. Prior to the Peyotero rule, Native American church members had harvesting practices that encouraged regeneration and propagation, practices that those of us who can still harvest conduct today. The intentions of land conservation efforts are not only to perpetuate peyote populations according to traditional practices, but to also restore and rebuild new relationships among Texas landowners, but most importantly, to reclaim our connection to the land and to the peyote in the wild. Engagement with landowners is already occurring. However, funding is needed to support our mutual efforts. Due to the already extirpated populations of peyote in South Texas, it is imperative that tribal voices be sought and opportunities be given to provide beneficial consultation on land development, peyote harvesting guidelines, and agricultural conversion as they apply to peyote. When I think of peyote, I think of my grandparents, my great-grandmother Bertha Tom, my children, my family, and my obligation to peyote and to reciprocity encouraged and guided by traditional peyote teachings and by science in modernity. Thank you.
Thank you. Julius?
Good morning, Chairman, members of the subcommittee. My name is Julius Murray. I'm a member of the Ute Indian tribe, and I serve as the UNA band representative for our business committee. Thank you for this opportunity to testify today. In recent years, the subcommittee has held to increase and improve funding for tribal programs. We appreciate these efforts, but more is needed. The funding provided by this subcommittee is essential to fulfilling the United States Treaty and trust responsibilities to Indian tribes. The Indian Tribe asks that the subcommittee focus on providing the funding we need to build a foundation for economic growth. We need more investment in Indian energy, safe tribal communities, infrastructure, and broadband. We need the same tools and basic services that every government uses to grow and support their economies. Indian energy development provides stable, long-term economic resources. Energy development funds our tribal government and the services we provide our members. It creates thousands of good-paying jobs and supports the development of infrastructure on our reservation and across the state. Our reservation is located in northeastern Utah and is the second largest reservation in the United States. We use cutting-edge technologies to develop our energy resources and manage our lands and resources. By being proactive, we can be a major energy producer while also protecting our environment and homelands. Using our management techniques, we have about 7,000 wells producing 45,000 barrels of oil a day. We also produce more than 900 million cubic feet of gas per day. We have been producing oil and gas for more than 70 years. Meanwhile, we also protect our homeland and are one of the first tribes to develop management plans for endangered species on our reservation. Despite our hard work promoting responsible energy development, BIA still does not have the staff, resources, or expertise to support our energy development. The GAO has been reporting for years that BIA lacks the human capital needed for efficient energy permitting. The Indian Energy Service Center in Denver, Colorado was a good start. This central office helps local BIA offices keep up with permitting requirements. We support creating this office, but our local BIA still needs petroleum engineers, realty staff, and environmental staff to keep up with our energy and economic growth. With more BIA staff and expertise, we could be issuing 10 times as many permits and contribute even more to domestic energy resources as well as our local, regional, and the national economy. Effective law enforcement is also needed to build a foundation for economic growth. We've done our part. We used $36 million of our own funds to build a new justice center. We also revised our law and order code to get tough on gangs and drugs. But we can't enforce our laws because BIA lacks the funding to fully staff the justice center. Instead, BIA uses federal funds to put offenders in county jails. Even worse, BIA tells our tribal judges to slow enforcement of warrants because BIA is running out of money to put offenders in county jails. This means they are released back into our communities. The subcommittee should increase the BIA law enforcement budget by 3 or 5 times over current levels. Almost all tribes are forced to supplement BIA law enforcement. We cannot build our economies without effective law enforcement. Infrastructure improvements are also needed to build our economic foundation. For decades, chronic underfunding of federal Indian programs has left us with crumbling infrastructure. If our roads, bridges, and water systems are falling apart, how can we build an economic foundation or even grow our economy? The federal programs that support tribal infrastructure are the modern-day expression of our treaties. We ceded vast lands and resources, reserved our homelands, and the United States promised to support our infrastructure. It is up to this subcommittee to make good on that promise. The more our infrastructure falls behind, the less we are able to generate the economic resources needed to sustain our government and support our people. Access to broadband is also critical to building a modern economy. In response to the COVID-19 pandemic, Congress provided almost $3 billion for tribal broadband. It is incredible that it took a global pandemic to bring reliable internet service to Indian country. Now that we have this critical funding, the agencies lack the staff and resources to get the funding out the door. We need dedicated staff to expedite, review, and approve these tribal broadband infrastructure applications. In addition, NEPA is getting in the way of broadband builds. Tribal government should not have to go through NEPA in order to deliver broadband to our communities. There's a lot this subcommittee can do to provide the funding and legal authorities to build a foundation for tribal economies. This is a treaty and trust responsibility, and we ask that you live up to those promises. Thank you for the opportunity to testify. I'm available to answer any questions you may have.
Thank you, Julius. I appreciate it. I didn't realize that it was the second largest reservation. Is the first largest Navajo?
Yeah.
And then I didn't know you were a second largest reservation, but anyway, I appreciate all of your testimony. Now I'm going to ask a question. I support religious freedom and the ability to use peyote and stuff for all tribes. In fact, when I was in the state legislature, one of the first bills that issues that came up, it's the first couple of years I was there back in 1870 or something like that, well, not that long ago, was the legalized transportation of peyote between states, that it was illegal in some states, and so the state was saying you can't transport it through the state and stuff. And is that still an issue across the country? Is there still states that have problems with that, or?
No, thank you for your prior work. We're able to address that. But now ARFA doesn't have any funds to be implemented.
Okay. This is the other question, though.
Yes.
You want to protect the land where it grows. As I like it this, and someone mentioned in their testimony, 96% of Texas is privately owned.
Right.
So I'm suspecting most of that land is privately owned, right?
Yes.
When I looked down at 2006, apparently there was the ability to go get peyote from these lands there. Did you pay for it when you went and got it, or was it just kind of free picking or whatever? I don't mean that in a bad way. Did the private landowner let you come in and pick peyote off?
If you have an established working relationship with the landowners, then you were able to gain access and obtain it the spiritual way. That's how it used to work.
But you generally didn't have to pay the landowner or anything like that?
Are you talking about in the past?
Yes.
Yeah, in the past.
Yeah, in the past it was mostly, offerings and
Right.
appreciation type thing. But
So
now there's a
So
process
now, the landowner is finding a higher value of use for his land.
Yes.
Right.
Whether it's wind towers, whether it's agriculture, whether it's something else. Where does the federal government have the ability or the right to step into a private landowner and say, no, you can't use that higher land value, you have to keep growing the habitat for peyote? I just asked this, I don't know, is the reason I ask it.
Mr. Chair, thank you very much. You're very, very, very inquisitive. A couple of things. Voluntary public partnerships.
Okay,
is one-
I'm all in favor of that.
one of them. The other one is a conservation program. Now, I know you're all familiar with farmers, let's say in
Yep.
Kansas.
Yep.
And if you don't want them to plant corn because it's overcrowded with corn in the market,
Yeah. Well,
so
and
then you
they have conservation programs to protect habitat for
Yes, sir.
pheasants and other things.
Right, and
Yeah.
so then we would pay a subsidy so they don't pay corn, grow corn.
Yeah.
But in our case, we're coming to the federal government with that same concept, conservation program.
Okay. I'm just wondering how you get from here to there.
Yes,
That's all I'm
Thank you
asking.
very
you
much.
know.
Yes, that's a great question. And the intention is to work with landowners. It's not to try to take over and reclaim their land. It's to work with them. Having spent time with landowners, I'm very aware of the pride that they take in land ownership. Some of their lands come from Spanish Inquisition. They're very proud to
Yeah.
have those lands.
Absolutely.
They also recognize that their ancestors had relationships with Native American people when it came to harvest in peyote. And some of those landowners that I have encountered maintain that relationship today.
Yeah. Well, I don't want you going to that other southern part below that border there, because as we've seen in recent days, that's
Yes.
not a good idea.
No, that's not a good idea.
But it is, it's an issue, and you can use conservation programs for those types of things.
Yes, sir.
Recognizing the rights of that landowner. And I will tell you, and I'll give you an example, and this is not, maybe it's not a correct example, but I think it is. There's an organization called the Peregrine Fund that in Boise, Idaho, that preserves falcons and other raptors and stuff. There's one called the Alpha Motto falcon. Its main habitat is in Texas. what they did is not using the Endangered Species Act or other things to try and force landowners to adopt particular behaviors. They went and worked with the landowners, where it made it a benefit to the landowner to preserve the habitat for the alpha motto falcon, and it's actually working. You know, so working with landowners, you can solve a lot of these problems.
Exactly.
So I was just curious about how what you're proposing would work, and didn't mean to criticize it or anything like that. I just want to know the basics of it. So I appreciate you being here and testifying today on this, and I look forward to working with you, because I'm, you know, I can remember when, like I said, in the state legislature, I can remember some of the debates on the floor, and some people would say, oh yeah, they just want to get high on peyote, and it was, you know, the next thing you know is you'll have the cocaine church, and because we want to legalize cocaine. Now, I think they've been using peyote in religious ceremonies, Native Americans have, for a long time, you know. So,
Yes, sir.
Did you come from Fort Hall today?
I came from Fort Hall a couple days ago,
Have
Monday.
you melted some of the damn snow there so I can go home again?
I think it's snowing right now, actually.
Yeah, that's what I hear. Shelley?
Thank you. Well, thank you very much for your testimony, and for, we've heard a couple of previous testimonies about the issue related to the decline in the peyote population, so it's helpful to hear the chair's questions and to hear more about how potential preservation or relationships with landowners would work, and perhaps, you know, an allowable use under conservation programs. I sit on the Ag Committee too, so I'm thinking through how that would work if that was a benefit available to landowners. So I'm interested in pursuing this a little bit more and learning more about it. The other question I had, though, is you also mentioned this potential licensing of the molecule or the mescaline substance for drug company uses. And there's been a lot more written recently about small doses of hallucinogenic drugs like psilocybin or LSD or mescaline used in mental health treatment, PTSD, some of the other things that people are talking about. And it sounded like, looking in your testimony, that's what this was about. And so I guess my question is, are you offering up sort of a second issue that says all uses of peyote should be only controlled by those members of the church, and there can be no licensing of the molecular substances in there or uses, you know, say in medical treatment or something else? Or would there be a way that if it was still controlled by, you know, tribal members of the church or something, that that kind of licensing could be done through them? I can't really figure out, are you trying to prohibit it completely if it has another medical purpose, or just saying who would have control over it?
What we're really concerned about is taking the sacred medicine and then starting to dissect it and then extracting molecules. That wasn't the intent of the sacrament. So that's the first thing. The second thing is the United States government, under the American Indian Religious Freedom Act, all we want to do is implement what the government, the law that they put in place. And the law says, and it exempts Native Americans from going to jail, or it would be a crime. So that's all we're asking for, is for the law to be implemented the way that the United States government put in place. It's also exempt in DEA. DEA in 1964 had put that exemption in place for Native American church members. Now, we haven't gotten to the point that you're talking about, and initially we're deeply concerned on what they intend to do.
Okay, I'll do a little more studying about it, and then I'm happy to
Thank you very
get back
much.
to you for
Can I
questions.
add to that?
Yeah, sure.
So one of the other issues that is of big concern to myself and to other Native American church members is that the ARFA, as amended, doesn't provide any protections for peyote itself. And so that's another big concern that we have, particularly because peyote is considered a vulnerable species. But it's made available to members of the Native American church, as you mentioned, for transportation, access, possession, use, as a medicinal sacrament. And now that we have this additional issue with decriminalization, psychedelic tourism, as I mentioned, that is becoming problematic. And
Psychedelic tourism?
psychedelic tourism, yes.
We're being nice.
Yeah.
I'm pretty sure you're not planning a committee trip around.
Yeah, I was gonna say,
Just guessing it's not on the list, yeah.
So that's definitely an issue to take up in the future, is how are we going to provide protections for peyote, the species itself?
Yeah.
We've also taken the opportunity to request for consultation with DEA. Texas Department of Public Safety has decided that they're not going to regulate it, so they've stepped away. So it's vacant there now in terms of regulations, and so we'd like to put something back in place there. So we're consulting with DEA, we're consulting with Department of Homeland Security, as well as other agencies. I just wanted you to be aware. Thank you.
Yeah, no, it's helpful, and I mean, there are certainly species of plants that are protected, even on private land, and I know the chair is well aware of certain things that, you know, can't be harvested even if it's your private land. And that's another complicated area, too, that private landowners rarely are happy about, so.
Right.
But anyway, thank you, and thank you very much for giving us a little more insight into your tribe, very different issues, but clearly having that large of resources, that great ability to harvest resources, and no permitting backup on that, I'm sure is extremely frustrating. Do you have any projects involving renewable energy, or is it mostly oil and gas?
It's mostly oil and gas right now, but we're in the process of doing solar.
And are there permitting issues there as well?
Yes,
Yeah, so
it's all around.
yeah, okay. Well, thank you for being with us today.
Thank you.
Permitting issues all across the country are difficult, and we're trying to streamline some of them while maintaining the safety precautions and all those kind of things. Could you tell me what is this in front of you here?
That is sweetgrass.
And
That is sweetgrass, and what you do is you can put it on a charcoal. The smoke that comes up, you smudge yourself with
Yeah.
it for blessings.
yeah,
And that's what I did.
so that's
thank
what
you
the
for
purpose
asking.
is? Yeah.
Yes, and that's why I'm
I
here.
noticed
so-
someone that testified had that before them
Yes.
yesterday, and I was wondering what it was.
Yes, thank you.
Same thing the Chauvins do with sagebrush and stuff, you know.
Yes.
Suter, they've had sagebrush with me when we did the opening of the firehouse and stuff, and
Yeah.
smoked it and not smoked it, but smoked it in a thing, and then you know, that kind of thing. So anyway, I appreciate it. Thank
Understand,
you all.
Chair.
Yeah, thank you all for being here today. I appreciate it very much. Okay, the committee will be adjourned till 1 o'clock. My 12 o'clock meeting almost on time. Not bad.